across all specialisms in the UK. In addition, he is as Vice Chairman of the Assessment Committee of the Royal College for Training Equivalence CESR, assessing and ensuring high standards of specialist care within the healthcare system. He has been Chairman of the Education Committee of British Society of Pediatric Gastroenterology, Hepatology and Nutrition for 5 years. During his tenure, he has revolutionized engagement with trainees, fostering a deeper understanding of pediatric gastroenterology, hepatology, and nutrition, and started new educational courses and research rewards. At the British Medical Association, he served as chairman of the Regional Council for 5 years, where he effectively managed regional activities, advocated for the profession, and championed high professional standards. His role as the chairman of the Regional Consultant Committee allowed him to empower the Consultant Committee, handling difficult issues while coordinating efforts to improve healthcare services. Dr. Gupta has been Royal College postgraduate tutor for pediatrics for 5 years at the Barnsley and propelled the post-graduation education and training to a very high standard, ensuring that the future generation of pediatricians were well equipped to excel in their roles. In addition, Dr. Gupta held the position of chairman of the local negotiating committee at the Barnsley Hospital for 12 years, where he bridged communication and negotiation with senior hospital management on behalf of consultants and other medical staff. Dr. Gupta's commitment to integrated healthcare is evident through speaking engagement at various conferences and publications, where he is endeavoring to amalgamation of modern medicine with alternative and complementary therapies. He is a director of the International Organization of Integrated Health Practitioners, and where he is actively stimulating practitioners to open thinking and accepting benefits of the other healthcare disciplines and provide a holistic toolkit to the patients with the best of each healthcare discipline. In addition to his professional role and recognition, Dr. Gupta's commitment to excellence in healthcare has been acknowledged through various awards, including an Outstanding Personal Achievement Award, 9 Clinical Excellence Awards, and Healthcare Excellence Award by the World Book of Award. We welcome you wholeheartedly, sir, and now I give you the mic to kindly share your valuable knowledge with us.
Thank you very much, Jinal. It has been really nice to be with you guys, and thanks for a great introduction. I think this is a very good forum, and it will be good to see the changing life experiences, how we together can make it a better care for a patient for which we all have become a doctor. So I was thinking, can I share my slides?
Yes, sir.
Let's go here. Can you see it?
Yes, sir.
Fantastic. So one of the important things that needs to happen, let me see it here 1 second. Good. So the first thing is that there is advantage and disadvantage of all healthcare discipline. I have been doing the actual allopathic medicine, modern medicine, conventional medicine, whatever you call, for more than 30 years. I have qualified, have become an assistant professor. I was the youngest assistant professor, long years, around 25, 60, or probably more than 30 years ago. But over a period of time, I have realized that it is not perfect. None of the discipline is perfect. Allopathic is fantastic. If you have a heart attack, you will go to the hospital, get whatever stent or bypass. But for a chronic condition, chronic arthritis, there is not much cure in allopathic medicine. So for example, you go, there is painkiller, paracetamol, ibuprofen, then you go naproxen, then you go into diclofenac, then you go into opioids, and then you go to amitriptyline, topiramate, all different types. But there is not really much in terms of a cure. So these all analgesics keep having some side effects. So you have kidney problems and renal failure and hepatotoxicity, nephrotoxicity, all kind of that stuff. If it's opioids, then you will have a degree of clouding of your judgment, sensations, dulling, etc. So if we can combine both sides, so say for example, for today's presentation, I will hopefully illustrate how combining the two can be very, very useful. So I think with that, let's just move on. So unifying the alternative medicine and modern medicine is a difficult task. None of us can pretend to say it's easy, but we must know that there is benefit of the two, and understanding of each side is important, because if we do not understand each side, we will lose the touch. We criticize each other. You go to allopathic, he says, oh, you're going to Ayurveda or homeopathy, oh, you're going to have problems. Some people will be even worse. They will say, oh, you will die. And same way, people go to Ayurveda or homeopathy, say, oh, modern medicine, oh, it is not good. That is not. We need to have a tolerance. We need to have a culture which is probably more beneficial to both. So that's my first starting point. The second important point is that we need to see the potential benefit of integration. And I will try and see if we can go through some scenario for you to understand that. And I also want you to be clear about there are challenges, and we will go through a little bit of that and the methods how we can overcome the challenges. So this is my dream. This is the International Organization of Integrated Health Practitioners, and I'm one of the directors. And what we are trying to do is combine everything. So conventional medicine or allopathic medicine or modern medicine with yoga, pranayam, Ayurveda, herbal remedies, homeopathy, acupuncture, acupressure, tai chi, qigong, hypnotherapy, chiropractic, massage therapy, aromatherapy, music therapy, dance therapy, and many more. Because each of these has got distinct advantages. Nothing is complete on its own, but if we can combine the advantage of each and create a toolkit which we can give to the patients to choose, and we as facilitator help him to choose and run with it and combine different tools in order to maximize the benefit, that would be the ideal expectation. And if you and I are the patient, we would love to do that. So that's kind of my second point. Then bridging the philosophical differences is the next step. So as I mentioned, that understanding and respecting different philosophies or discipline is the first part. The second important part, which I hope we are doing to some extent today, is educating the doctors about different healthcare approaches. So from what I hear, that there are some allopathic or modern medicine practitioners, including cardiologists in the audience, and we also have Ayurveda practitioners. So hopefully together we will try and put our minds so as to combine that. And then we can educate the patients, because that is the other big problem. And the third step is interdisciplinary dialogue. So we have a dialogue between the two. And this is a big problem in UK, but probably less in India. People are more easy to conversate. And then we bridge the cultural differences and have the cultural sensitivity, so that we cultivate that we have understanding and like circles overlapping each other in order to increase the overlap and develop the integrated care models. So now let's go to some cardiovascular problems. So you know that cardiovascular burden is very high. There are around 17.6 million deaths every year globally, and around 6.5 of these are premature death, i.e. less than 70 years old, which is 38%. So it's a massive global burden. And if we can combine the modern medicine approach and the Ayurvedic approach, say, for example, we take only two disciplines today, it will be fantastic because we understand modern medicine approach to the cardiovascular problem is very different. If you have got high blood pressure, take beta blocker. If you have got hyperlipidemia, take statins. If you have got heart failure, take digoxin, whatever, all variety of medicines are there, and that's advancing. The approach is different because it's based on the evidence, the cross-controlled double-blind trials, and they use medicines on one side, placebo on the other side, and find the clear difference. Where there is clear difference, they continue to use it, and that's how it works. Ayurveda, on the other hand, has got 5,000 years of history where it has developed. But the number of the trials, particularly the double-blind, cross-controlled trials, is very little, and that's the area we need to advance or extend. However, if we can combine the benefits of two, that is quite ideal. Are you okay? You're okay to hear me well and you can see it well. Is that correct?
Yes, sir. Yes, sir.
Fantastic. So now the next is the potential for integrating the two. So if you guys are happy so far, let's try and do some work, not just now, over next few months. And I would like to connect to you all guys, how we can work on this in order to create the best scenario for the patients. And I will run through some of the case scenarios here, but they are just the examples. There is a lot more that we need to do. So saying all that, there is already work done and there are credential evidence of the Ayurveda in the cardiovascular problems. So there is plenty of evidence in modern medicine. Every drug is going through the cross-control trial before it is marketed. And there are lots of papers published. I know that, and most of you will know that. On the other hand, there is not as much, but there is still good enough evidence within Ayurveda literature. So that is the other part, we need to do that. So let me then go to the next step, and I will take just one scenario, say for example, the first one of hypertension management. Now, hypertension is very common. Every second, third person you will meet in your family or your friends is having hypertension. Now, if you go through the typical modern medicine or conventional medicine approach or allopathic, you use drugs and you use lifestyle modification along with it. So ACE inhibitors, beta blockers, and a variety of things. I don't want to spend a lot of time telling, but these are all used as a typical approach. On the other hand, if you go to Ayurvedic practitioner, he will use dietary changes and herbal remedies, and there is evidence about some of these, including the sargandha, arjun, etc., in the hypertension. And when it's combined with yoga and meditation, it has got a reasonably good effect. So the next step is then, if we can combine and integrate both, then it will need to improve in the stress management, potential reduction in the drug doses, and particularly the antihypertensives that are needed, and we will have fewer side effects and improve the quality of life. Then if we take the next scenario, for example, if it's coronary heart disease, then a typical modern medicine practitioner will say, use the drug statin, aspirin, which is going to do that. And if it is the next step, stroke, a heart attack has happened, you are going to do stent or bypass. If it is happening to Ayurveda, that person will again suggest using arjun, garlic, and lifestyle changes, and some foods and diets, and some plant medicines in order to try and help. Now, if you know that if heart attack happens, you are not going to go to Ayurvedic practitioner because that's going to just let you die. There is nothing urgent in terms of like stent or bypass available in Ayurvedic medicine. It's a slow preventative medicine that is going to really help slowing the progress of disease and possibly reversing the disease process. So if we can combine the two, the acute and the chronic conditions together, and the treatment also immediate and the long-term treatment, it can prevent the disease progression, reduce the disease progression, and enhance the recovery. Even after, say, bypass or after the stent, you can really help that. So let's come to case scenario third, which is heart failure. So again, if you go into the modern medicine practitioner, he will have ACE inhibitors, beta blockers, diuretic, and then additionally, they will give you some advice on lifestyle modifications and monitoring. And I must say, many modern medicine practitioners are too busy to even give you that advice. They will write a prescription, and I go to India quite often. People don't have time. You go to doctor writes, you tell the problem, the doctor write a prescription on piece of paper and give it to you, and you go and get it from the pharmacist next door. They don't even have the time to explore. While you and I know actually that just medicines do not work. It is a lot more than just medicine. It's medicine, the lifestyle changes, thinking about your own life, a family, reducing the stress and all that, which actually work together. So in Ayurveda, there is a lot of emphasis on diet, lifestyle changes, and then restorative therapy, particularly Panchkarma, which is quite good. So if you can integrate these two, you can have a better quality of life, you have a holistic care, and overall increase in the recovery. Let's take the fourth case scenario, which is managing the dyslipidemia or high lipids or high cholesterol. So if you go to a modern medicine practitioner, he will tell you typically or write as statins and then or lipid lowering medications. I know there are a lot more now, but I have just put example one or two. And then if they are very careful and they are very dedicated, they will advise you about lifestyle modification. On the other hand, if you go to Ayurveda practitioner, he will tell you about balanced diet and may use some herbs like gugu, garlic, and then lifestyle changes. So all that together with balanced life is going to really combine lowering the lipid control, reducing the doses of the medicine or statins that you are using, and also overall better and fit lifestyle. Let's go to the next case scenario or scenario 5. If there are any arrhythmias that's happening. So you have arrhythmia, it's very difficult situation, and arrhythmias of different types. And I understand that, being a medical practitioner, I know that. However, there is not as detailed description in Ayurveda. There is more detail, you do the ECG, it is a rhythm, it's a whatever, simple sinus arrhythmia, or it is a supraventricular tachycardia, it's a ventricular fibrillation, atrial fibrillation, all kind of that stuff. And you can prescribe the medicine, beta blocker, calcium channel blocker, or even do the procedures like ablation therapy or pacemaker. And these are not available in Ayurveda. However, there is a lot more in terms of restoring the life balance, the diet modification, lifestyle modification, meditation, breathing exercises. So all this helps opening the channels. It can help controlling the heart rate, because you know that a deep breath in, deep breath out, like Anulom Vilom and Bhastrika, actually slow down the heart rate, because deep breath in actually causes a change in the way the vagus nerve is activated, and you know that vagus nerve causes slowing of the heart rate because it's parasympathetic. So there is a scientific basis. I don't have time to explain. I have done years and years of study in depth of both systems, and I have tried to combine it, and we may get some other opportunities. But if you do the integration, then the invasive procedures become less, and there is improvement of the symptoms control and reduce need of medication through the stress management. go to the next case scenario, which is the last case scenario I'm using here. Say, for example, atherosclerosis or deposition of plaque or fat into the blood vessels, which include the heart. If it's heart attack, it can include the stroke, which is deposition of the same in the blood, antihypertensives, and then maybe in invasive procedure like angioplasty or bypass surgery. While there is a role of diet, meditation, and panchkarma and lifestyle changes and many more things in Ayurveda. But if we combine the two together, here we can slow the progress of the atherosclerosis and need for various medicines and the procedures. So this way, we need to think collectively the future of the integrated cardiovascular care is really good. And you can, I am not saying prevent all these 17.5 million deaths, but you will be able to prevent even half of them and slow down the progress. It will be fantastic. And you cannot do isolated in Ayurveda or in modern medicine or allopathic medicine. Combined approach is massively useful. So when we can incorporate the integrated care into medical education, the future generation will even become better. And the other step which we need to do is to have the policy and the policy makers to promote the integrated care. And I'm having a lot of difficulties here because, as you know, Western medicine and Western world go together. So this is the default. But we have made a lot of difference here. I go speak in the national, international conferences. We have all people parliamentary group and different mechanisms to try and influence, and it is a lot better now. We are even doing a trial on ashwagandha in long COVID. So it's just one of those things which take time, but if we keep constant push, it will happen. And then we can use technological advances for improving the integrated care. And this is like combining, for example, all the different type of health practitioners across the globe. So we have a global health program where we use the integrated organization of the health practitioners, which I shared with you earlier, but also Healing Our Earth. So there are different platforms we use to combine the practitioners, and this Zoom has a technology that allows us to speak. And similar is the technology in view of the algorithms that we can set based on the presentation, the Vata Kapha Pitta, and the age and the symptoms together, and also the medicines which have more robust evidence. So evidence-based combined with this, we can create a mechanism which we can help the patients to use for their life and improve the care, prevent diseases, but also reverse the diseases. So I think I will stop it here and then we can talk later. Thank you.
Thank you so much, sir. That was indeed a very novel approach, and you have enlightened us, and we look forward to sharing further knowledge with you ahead in the coming months. Now, I would like to welcome Dr. Omkar Chaudhary, who is our second chairperson for the session. Dr. Omkar Chaudhary is the head of Learning and Development Department at Madhavbagh. Associated with Madhavbagh since the last 16 years, he has trained more than 1,000 doctors of the institution and has taken more than 500 public awareness sessions till date. Last but not the least, he is a crazy person who is in love with Ayurveda since the first day of his college life. I'm fortunate enough to know him for a very long period. I welcome you, sir, and I would ask you to share a few words with us.
Right. Good afternoon and welcome everyone. This is a fantastic third day of the second National Ayurveda Cardiology Symposium. And thank you, Dr. Jinal, for such fantastic introduction. And I'm really grateful to have Dr. Rajeev Gupta, sir, today. And for giving his valuable time and sharing his vast experience. I hope all the participants who have been with us since last 2 days have seen a lot of senior and very experienced doctors who have come and researchers who have come and taught us very minute things which I don't think in our curriculum we have ever heard of, seen of. Right. So this is something new which we need to inculcate in our daily practice, so that this new sort of an integration will help us even better in the patient improvement, which is the bottom line of story of Madhavbag. All of the doctors of Madhavbag, all the staff of Madhavbag is basically into hardcore medical practice, wherein we are giving a 360-degree approach for patient improvement. And as Rajeev Gupta sir rightly said, that not a single medicine or a single pathy can give 100% results to any patient. It is always an integration which is going to help all the patients in future. And last 2 days of all the presentations were just superb. Every doctor who has taken efforts to treat your patients and scientifically present your presentation in front of this scientific faculty, you have taken a lot of efforts. And I wish really best of luck to all the doctors who are going to present their sessions today as well as tomorrow, as it takes a lot of courage. You need to be a brave heart to present your findings, your achievements in front of all the participants who have joined across the world. Now you may be seeing there are many participants who have joined us from UK, US, and in spite of the time issues, still most of them are with us till 11 p.m. at night, the first day wherein we were together near about 11 p.m. till night. Now this is something which is a positive thing everyone should take, and we need to take a very single positive inputs from every person who is in front of us, because that every single point is going to help us in improving ourselves for becoming a better practitioner of Ayurveda in days to come. So without wasting much time, I think we have a lot more to learn in next 2 days, and I will request Dr. Jeenal Thakkar ma'am, kindly please start with the first presenter. All the presenters, I will just like to wish all of you very best of luck, and please make sure 5 minutes is the time. So please make sure you keep your theory, your researches in 5 minutes, so that you get 1 minute for further discussions with the chairpersons or the participants. Secondly, you need to highlight how you have got those results, because all the participants over here are more interested to understand what is the thought process wherein you have got these results. How exactly have you diagnosed this case, and how exactly you have improved this case? So what was your thought process? What was the methodology? What was it the medicines which has cured your patient? Was it the diet, or was it the Panchakarma regimen? You need to be very precise, and that too in 5 minutes time. So all the very best to all the participants of today as well as tomorrow's session. Over to you, Jinal madam.
Thank you, sir. Spoken like a true training head. So all our presenters have rough instructions. 5 minutes for your presentation. 1 minute would be for the Q&A with the chairpersons. And I would request all the participants to try and stick to the time limit. I would now like to invite the first presenter of the first session of day 3 of the National Ayurveda Cardiology Symposium, Dr. Charan Sonare. Welcome. The stage is all yours. Dr. Charan, I would like to kindly like you to unmute yourself.
Okay, madam.
Yes.
Can I audible, madam?
Audible. Yes, you are audible.
Can you share my PPT your end from your end?
Yes, Dr. Pallavi will be sharing the PPT. Pallavi ma'am, can we have a, yes. Yes, doctor, please go ahead.
My name is Dr. Charan Sonare, OPD from Varud, and my topic is the role of Panchagavya milk and urine in liver cirrhosis and ascites. A case study. Next, uh, ascites is the accumulation of water in peritoneum. It is the liver disorder. A case of 41 years old male came to my hospital with pedal edema, exertional dyspnea, uh, distension, and with constipation with like hepatoencephalopathy symptoms. The main role of Ayurveda is there is related with the Jalodhara. And main next, it is a three doshaj Vyadhi and related with Jalodhara in Ayurveda. There is a arm nirmiti and a koshta so that there is no urine output and motions properly. There is a fluid collection so that because of ammonia the patients comes with hepatic encephalopathy. So with the help of Ayurvedic purgation, continuous purgation by the diet Nirlavan and Nirjal diet, the patient gets proper results. Next, patient was alcoholic from 20 years and 41 years patients. Next, I like to highlight on the treatments. Next, man. The vitals of that patient is like that. And systemic inspection is the distended abdomen, palpation tender in right hypochondric region, percussion, shifting dullness, and fluid cell present, and pipedal edema. The results of that patient get by continuous purgation, Nirlavan Nirjal Pathya, and continuous medicine given by Basti. The result is there on 9/1/23. The bilirubin of that patient is 12.91, and on 15 February, the bilirubin of that patient 1.49. The patient with in hepatic encephalopathy, that time ammonia is 320, and on 15 February, the ammonia is below 100, and the sonography report is gross ascites with hepatic liver cirrhosis and distension abdomen. Then patient got result like this, gross ascites. Then on 15 February, there is mild ascites, and because of purgation, the ammonia is washed out, so that the uh, blood blood-brain barrier caused by ammonia is less counting, and the patient come from hepatic encephalopathy. Next, the symptoms of that patient is reduced gradually in this measure: anorexia, vomiting, abdominal distension, respiratory distress, general light weakness, disturbed sleep, and bilateral pedal edema. So number of cases we can treat by Ayurvedic treatment, and the basic is Virachan and Basti. And main next one, the main is Go Mutra and Go Dugdha. That is the Panchagavya. The patient is keep on only Go Dugdha without water and without diet, and only there is a milk is important in diet manner. Next, Pathya is only on patient is keep on milk, cow milk for 45 days, then result in front of you. Next, diet medicine Go Dugdha and Nirlavan, Gomutra is 60 ml per day. As per requirement, milk is there recommended for intake. Next,
So last 1 minute.
That is medicine. Next. So conclusion is that with the help of Ayurvedic medicine and virachan, that is continuous purgation, we can treat ascites, hepatic encephalopathy with the help of Gomutra and Godugdha, that is Panchagavya. That is my case.
Wonderful. Dr. Rajeev Gupta would like you to ask your questions to the presenter. Sir, if you have any questions for the presenter.
And thanks to Madhavag, that is different case, giving me permission for presentation.
Omkar, sir, would you have any questions for the presenter?
Yes, fantastic presentation, Dr. Charan Sonali, sir. And I just wanted to know the exact tenure of this treatment, as you have got fantastic results. Abdominal girth from 105 to 94, serum bilirubin from 12.91 to 1.49. This is really fantastic. But what was the exact tenure of the treatment?
Yes, sir.
What was the exact duration of the treatment?
From the 12 bilirubin to 1.2, that period is only 45 days. Now 45. The patient is okay.
Okay, fantastic, fantastic. And were any other investigations done apart from whatever parameters you have mentioned? Were any investigations done?
CBC continuous LFT,
Okay.
sometimes KFT, and UHG observation.
Fantastic.
And sometimes X-ray chest for the pleural effusion findings.
So was there any pleural effusion earlier in the first X-ray, and was there any reduction in the pleural effusion in the further X-rays which you have taken?
Yes, sir. Yes, sir. There is a pleural effusion in first 15 days. Then after 45 days, there is no pleural effusion. So the breathlessness and exertional dyspnea patient was normal.
Fantastic. So just a suggestion, if the next time whenever you present, it will be easy if you can keep some images of the first, the pleural effusion on the first day, the X-ray over there, and the latest one, so that it will be a very good sign for all the doctors to understand that even in ascites, you get pleural effusion, and the treatment over there is virachana, because the treatment which you have done is basically of Jalodhara, and the treatment is virachana. Now, some of the participants have asked whether Gomutra, what was the mode of giving the medicine as Gomutra? How did you give Gomutra? Whether it was oral medication or through basti or any other format?
By two way, 60 ml by mouth, and 120 up to 120, 60 to 120 ml basti.
Fine, very nice.
Alternating using.
Very nice. We have good number of questions about this case, and I will request Dr. Charan Sonare sir to kindly answer in the chat box before we move on to our next presenter. It was a fantastic presentation, awesome results, because getting the serum bilirubin from 12.91 to 1.49 in just 45 days, and that too reduction in abdominal girth, is really fantastic. Super results, sir.
Sir, more than 100 cases we are treated that way.
Kya baat hai. Very nice. Fantastic. Fantastic. Yes, Jinal madam, over to you.
I think Dr. Rajeev sir is back with us again. Sir, do you have any questions for the presenter? I think there are no questions from his end. I would like to welcome the next presenter, Dr. Shailesh Mukund Kenge, for his presentation. Dr. Shailesh, the stage is all yours.
Okay. Good afternoon, all of you. Myself, Dr. Shailesh Kenge, My case study is the role of Ayurvedic treatment in the management of dyslipidemia in obese patients. These are the contents. Research question: to assess the role of Ayurvedic treatment in the management of dyslipidemia in obese patients. Objectives are.
Sir, if you could just, I'm sorry to interrupt, could you just put your PPT into slideshow mode, sir? Yes, Pallavi ma'am has already shared your PPT. You can go ahead, sir.
Okay. Objectives are to control the weight of the patient by controlling BMI with weight management treatment, lipid control, and hypertension control. Next, the patient medical history. Male patient of 25 years old, having history of obesity since March 2015. Family history of cardiovascular disease. Location in Buldana. The course of the patient is weight gain since March 2015. Then noted dyslipidemia in 2022, and then hypertension in 2023 in the April month. Next, please. The case description: the present complaints of the patient is dyspnea grade 2 from 6 months, chest heaviness from 4 months, and headache from 4 months. Next, please. Physical examination of the patient is weight is 95 kilogram, height is 170 centimeter for the patient. Then BMI is 33, BP is 160 by 100 mmHg, SpO2 is 98, and heart rate is 82 per beat per minute. Next, please. These are the investigations done before starting the treatment, and 27 February 2023. The values of the lipid profile are as below. Cholesterol and triglycerides are very much increased. LDL levels also increased to 165. Next, please. The diagnosis of the patient is dyslipidemia with obesity with hypertension. The treatment given as follows in 5 aspects. First is diet. In diet, the diet given to the patient is 800 calorie, high protein, high fiber, and low carb diet for the 2 months. Then Panchagavya therapy, Snehan by Neem Siddhatel, Svedan by Dashmul Kada, Basti by Kulit, Nagvel Patra and Gudmar Path, and Shirodhara by Jatamasi Kada. This therapy given to patient weekly once for total 10 sittings. Then medicines given to the patients are Gumutra Hariti, twice BD. Then Kumari Asav, 10 ml BD, and Amruta Gugul, 2 tablets BD. Arjun Punarnava Vacha, Vath, 10 ml BD. These medicines are given. Then exercise, in exercise, daily 1 hour walking, and then yoga by the specialized and monitored by specialized app MIB Pulse. Then in monitoring section, daily diet and exercise are monitored in this app by MIB Pulse app. Next, these are the results before and after. The weight of the patient is weight loss of the patient is 14 kg. Abdominal girth loss is 9 centimeter. Blood pressure is in normal. First it was 160 by 100, then it is 120 by 80. The total cholesterol, firstly it was 222, then it is 153. SDL was 36, then it is 30. LDL is 160. LDL was 165, and now it is 104. And triglycerides are also decreased. The lipid profile is in normal Now, next, these are the before and after reports of the patient of the lipid profile. Next, discussion. In diet, 800 calorie, high protein, high fiber diet, low carb diet that plays an important role in the weight reduction, and this diet has anti-lipidemic action also. In Panchagavya therapy, we given Snehan, Svedan, Basti, and Shirodhara to the patient. These therapies also have excellent anti-lipidemic, anti-hypertensive action. Jatamasi is the remedy for reducing the stress, hence it acts as an anti-hypertensive. In medicines, these medicines are also good in anti-lipidemic and anti-hypertensive action. Next.
Doctor, last 1 minute.
Yes. Conclusion, this overall treatment was efficacious in controlling dyslipidemia and hypertension in male patients that were overweight or obese. Next. References. Next. Thanks.
Wonderful presentation. Dr. Rajeev, sir, if you have any questions for the presenter. Dr. Omkar, sir, if you have any questions for the presenter.
Yes, Dr. Shailesh, it was a fantastic presentation, and the efforts taken by you in treating these patients are really nice. Just one question, if you see the HDL of the patient, now
Yes.
it has come from 36 to 30, whereas
Yes.
all the other parameters have improved, right? The total cholesterol has reduced, the LDL has reduced, triglycerides have reduced, but the HDL has also reduced. So
Yes.
what was the exact reason? What do you find it would have changed, if you could have improvised on some sort of a treatment wherein the HDL would have been same or would have been better, right?
Yes,
Apart
yes.
from all the other abnormal values coming down to the normal range. So what better could have been done in this case? What do you otherwise this case is?
Yes, sir. In this, the go Gupta should be started with the diet. Then I have added it.
Okay, so just one more question before I think Rajeev sir does have some question. Go if it needs to be used in the treatment, first and foremost thing, the patient's Sam Avastha or Niram Avastha needs to be checked, right?
Yes.
And as an Ayurveda graduate, if it's the Sam Avastha, then we usually prefer Erandakal.
Yes.
And then once Nirama Avastha is seen, then we move on to the Go-Ghruta. Obviously, there are n number of researches that Go-Ghruta improves the HDL cholesterol, right? But the first and foremost thing is exercise is one such regimen which will improvise the HDL cholesterol if the patient works, exercises on empty stomach at least for 30 minutes. So was that kind of a regimen included in the treatment of this patient? Whether this patient was exercising or whether you were actually monitoring the patient.
To the patient. Yes, he's regularly exercising, and I am monitoring his exercises through the app, and he is also doing yoga sessions also.
Fantastic. So just the next time when you do the lipid profile, just keep an eye on the HDL. Rest all is just superb.
Okay, sir. Thank you, sir.
Yes, ma'am. Over to you.
Dr. Rajeev, sir, you have the questions for this current presenter, Dr. Shailesh.
Yeah, I think it was good, quite useful. And over a period of time, I think we should see a lot more research and expansion on this in order to get more practical results. So I think overall pretty good effort. Thank you.
Okay, thank you, sir.
We'll move on to the next presenter. I welcome Dr. Awadh Pachori for his presentation. Dr. Awadh. The stage is all yours.
Good morning, sir. Good morning, all of you. Myself, Dr. Awadh Pachauri. Sir, आवाज आ रही है?
हाँ जी.
Myself, Dr. Awadh Pachauri, Clinic Head, Dhamtari, Chhattisgarh. I am presenting my case study on role of Anvasan Basti and Shastrokht Brechan in resistant blood pressure. Objective of my study is
So we cannot see your
resistance
presentation on screen.
Yes, ma'am.
We cannot see your presentation on screen. I would request you to switch to your presentation.
यहाँ से तो शेयर दिख रही है मैडम.
Or if Pallavi ma'am could share his slides, please. Sir, you can stop sharing your screen. Pallavi ma'am has shared your presentation. Yes, sir, please go ahead.
Myself, Dr. Awadh Pachauri, Clinic Head, Madhobag Clinic, Dhamtari, Chhattisgarh. My research topic, role of Anvasan Basti and Shastrokht Brechan in resistant blood pressure. Objective of my study, resistance hypertension is defined as the blood pressure that remain above 140/90 despite optimum use of 3 antihypertensive medicines. 16 January 2022, a 43-year-old man come to me who is working as a constable in police department with symptoms severe headache and acidity. He was known case of hypertension from about 10 years and was taking allopathic treatment from 2017-18 with hypertensive medicines, which were beta blocker, ARB, and diuretics, and are even hospitalized twice for this problem. Parameter of this patient: height 167 centimeter, weight 70 kg, abdominal girth 87, pulse 86, BP 186/113, respiration 16, SpO2 98, blood sugar level 105, investigation done, hemoglobin 14.4, total cholesterol 166, triglyceride 171, HDL 38, LDL 94, total cholesterol and HDL ratio 4.36, serum creatinine 1.1, appearance of urine turbid protein present, stress test, ABPM, 2D echo was done, investigation advised, HB, LFT, RFT, TFT, lipid profile, and microalbumin and EGFR. Hypertension patient diagnosis was hypertension with obesity. Oral medication Punura, Arjun, Gokshur, Haridra, Amalki, and Arand was given. Diet 100,000 kilocalorie diet with low carb and high protein, high fat diet advised. Panchkarma 7 Anuloman Basti and Shastrokht Brechan was twice done. सबसे पहले पेशेंट के 7 पंचकर्म और 1 शास्त्रोक्त ब्रेचन किया गया, साथ में उनको गोक्षूर, हरिद्रा, आमलकी, अर्जुन, एरंड और शुंठी हरितिकी जैसे औषधियों के मिश्रण से उनको औषधि चिकित्सा दी गई और साथ में 1000 किलो कैलोरी का लो कार्ब, हाई प्रोटीन एंड हाई फैट डाइट एडवाइस की गई। सेकंड विजिट में उनको अभिपत्तिकर चूर्ण और हरितकी को एक्स्ट्रा ऐड किया गया, साथ में एक्सरसाइज, योगा और प्राणायाम को रेगुलरली करने के लिए बोला। उसके बाद में उनका सेकंड शास्त्रोक्त विरेचन हुआ और शुंठी और ब्राह्मी का योग साथ में ऐड किया गया। और इस तरीके से
1 minute.
हाँ, इस तरीके से उनको 3 महीने तक ट्रीटमेंट हमने दिया। नेक्स्ट, पैरामीटर बिफोर एंड आफ्टर, वेट 70, then 63, abdominal girth 86 to 83, BMI 25.1 to 23, SpO2 99, respiration 16, pulse 65 to 58, BP 188, 113 to 125, 78, ABPM, evidence of stage 2 hypertension. After treatment, no evidence of hypertension, evidence of white coat effect, no evidence of white coat effect. Dip in night is not adequate, dip in night is adequate.
Please come to conclusion.
Conclusion, how Gokshur, Arjun, Sunthi and Brahmi, these 4 drugs shows result on resistant hypertension, so blood pressure reduces. Second, Anuloman Basti and Shastrok Virechan can be effective in resistant hypertension. Modern point of view, resistant hypertension is a condition where your blood pressure remains high or unmanaged despite the medication you take to lower the hypertension. Is a major health issue. High blood pressure itself rarely causes symptoms, which is why it's called silent killer. Some people can go years without knowing, even realizing they have hypertension, but untreated hypertension is potentially dangerous to our health. Lifestyle, diet, sleep apnea, this should be included in discussion. Ayurveda aspect, hypertension can be compared to a condition called Raktagat Vata. In the condition, vitiated Vata get locked in the circulating Rakta Dhatu and cause disturbance in its circulation. Since Rakta and Pitta are related in a inseparable.
Sir, I would request you to conclude.
Relationship. Next, Anuloman Basti and Shastrok Virechan can be effective in resistance blood pressure. That is my conclusion. Thank you.
Thank you, sir. Dr. Rajeev, sir, if you have any questions for the presenter.
Yeah, I wanted to ask how confident you are that I understand you say Rakta and Pitta are related and therefore your methodology will work. But how sure you are in a general population that it will work?
Sorry.
Did you hear the question?
I hear but can't understand.
What you have said.
Yes, sir.
How confident you are that you are correct on a scale of 1 to 10? Okay, don't worry.
Sir, I can just repeat your question. Dr. Awadh, राजीव सर ये जानना चाहते हैं कि आपने रक्त पित्त का जो एक कंपैरिजन बताया, तो एक जनरल पॉपुलेशन के केस में क्या आप इतने ही कॉन्फिडेंटली ये बात बता सकते हैं?
हाँ, एक्चुअली मैडम, ब्लड प्रेशर बढ़ने का एक मुख्य कारण है कि हमारे ब्लड का वॉल्यूम बढ़ना, और जब हमारा पित्त दूषित होता है और अम्लता के साथ रहता है तो उसमें वो वॉल्यूम में ज्यादा होता है, और वॉल्यूम में ज्यादा होने के कारण वो ब्लड प्रेशर को बढ़ाता है। तो इसलिए मैं इस मामले में कॉन्फिडेंट हूं कि रक्त यदि अपनी अम्लता के साथ में बढ़ रहा है, दूषित पित्त यदि बढ़ रहा है और रक्त के साथ में वो कोलैबोरेशन में बॉडी में सर्कुलेट हो रहा है, तो वो रक्त पित्त व्याधि करेगा, जिससे कि ब्लड प्रेशर बढ़ेगा।
अच्छा, इसका दूसरा ये मैंने प्रश्न इसलिए पूछा कि एक हमारा हो गया कि ब्लड का वॉल्यूम बढ़ा, लेकिन ऑल्सो दूसरा इसका हाई ब्लड प्रेशर का कारण होता है हमारी धमनियां संकुचित हो जाती है और ब्लड वेसल्स आर कॉन्स्ट्रिक्टेड, सो ईदर योर ब्लड वॉल्यूम इज मोर, दैट मीन्स जैसे उतने ही पाइप के अंदर अगर ज्यादा पानी जा रहा है वो एक ब्लड प्रेशर का कारण है। दूसरा पाइप छोटा हो गया, पाइप सकड़ा हो गया, तब भी ब्लड प्रेशर बढ़ेगा। तो अगर ब्लड प्रेशर ये जो धमनियां हमारी ब्लड वेसल संकुचित हुई है, क्या इसके अंदर भी वो काम करेगा और क्या उतने ही तरीके से काम करेगा, ये पूछने का कारण था।
हाँ सर, हमने उसके लिए अनुवासन बस्ती और ब्रेचन का इस्तेमाल किया, जिसमें हमने गौघृत का यूज किया, जिससे हमने एंडोथेलियम को रिपेयर किया और एंडोथेलियम के वर्क को भी ठीक किया, जिससे कि वो धमनियों के एक्सपेंशन को मोटिवेट कर सके। और गोक्षूर आमल की हरिद्रा का कल्प हमने जो यूज किया, उससे हमारा एंडोथेलियम रिपेयर भी हुआ और एंडोथेलियम रिपेयर होने से हमारी फ्लेक्सिबिलिटी ऑफ आर्टरीज बढ़ी, और जिसके कारण ब्लड प्रेशर वो जो ब्लड के वॉल्यूम को एकोमोडेट करने के लिए उसका क्षमता बढ़ने से ब्लड प्रेशर कम हुआ।
आई थिंक दैट्स गुड, थैंक यू।
Dr. Omkar sir, if you have any questions for
Yes,
Dr.
Awad
Raval.
sir, first of all, congratulations. The blood pressure of the patient has come from 186 by 113 to 125 by 78. So that's a good achievement by you. And second thing, now you have mentioned resistant hypertension. So was any investigation like an ABPM done in this patient?
यस सर, एबीपीएम का रिजल्ट मैंने शेयर किया सर साथ में, एबीपीएम पेशेंट का किया गया था सर।
So now if the ABPM was done and initially you have got resistant hypertension, and what was the final conclusion after the treatment?
Final conclusion of treatment is that कि अनुवासन बस्ती और
on the ABPM report, whether a second ABPM report was conducted in this patient.
Okay, sir. Sir, no white coat effect, no dip, not adequate dipping in night, and second stage का जो hypertension था, वो hypertension उसमें detect नहीं हुआ.
Perfect. Because Rakta and Pitta, they have Ashra-Ashrayi Sambandh, right?
Yes, sir.
Hence, what the treatment which you have used is perfectly fine. You have selected Shastrokta Virechan, apart from whatever the other medications you have suggested to the patient. So the treatment methodology was perfect, no doubt about it. And if the ABPM report also mentions that initially it was a resistant hypertension and the second one it was not a resistant hypertension, definitely the treatment given to the patient is really good. Hence the blood pressure has reduced. Now the last question I will like to ask, whether his allopathic medicines was stopped at the end.
Yes, sir. Totally 100% medicine is stopped from 1 year.
Fantastic. That's the achievement of Madhobag doctors. Superb. And you have proved it on the ABPM report as well, for the scientific fraternity to understand that initially the patient was on antihypertensives, while in the first ABPM report it was resistant hypertension. And now that all the medicines have been stopped, still the blood pressure is 125 by 78. That's a fantastic achievement to you. Congratulations, Dr. Awad.
Thank you, sir.
Thank you. Yes, Dr. Jeena.
Thank you, sir. I would like to call upon our next presenter, Dr. Niran Shahare, sir. Dr. Niran, the stage is all yours.
Hello, ma'am. Please share my presentation. Pallavi, madam. Hello, I'm good afternoon, everyone. I'm Dr. Niran Shahare from Madhobag Mini Clinic, Lahando District, Bhandara, Maharashtra State. My presentation's name is Management of Avascular Necrosis, Bilateral Femoral Head by Ayurvedic treatment. Next slide. Next slide. Next. Objective of my presentation is, that there is no satisfactory therapy is available in conventional system of medicines for avascular necrosis. While the available procedures are not affordable by all, prognosis of all such approaches are not convincing. Next slide. In medical history, there's a patient, age 25-year male. In 2017, he has history of fall. In 2018, he got pain in bilateral hip joint. In 2022, he had done investigation of MRI bilateral hip joint done, and he was detected as avascular necrosis bilateral femoral head. So an orthosurgeon advised surgery. In 2023, he came to me at Madhobag Mini Clinic, Lakhandur, and I gave a treatment, Ayurvedic treatment, and he got relief from symptoms. Next slide. Next slide. Okay. In case discussion, I will show you this. You can see the report of MRI. That patient, he an history of fall before 6 years, and he has complaint of pain at bilateral hip joint with restricted movements, difficulty in walking, unable to stand up from sitting position, unable to drive bike, has difficulty while doing his routine job of vegetable selling at market, and difficulty in forward bending since 4 years. Investigation of the MRI. Next slide. So I diagnosed according to the MRI report that stage 3 AVN involving right femoral head with stage 2 to early stage 3 AVN involving left femoral head. Next slide. I gave treatment like Rukshodvardhan for first 5 days, that I use barley flour, wheat bran 150 gram plus Sirprazurna 50 gram, and for Dipan Parva, Chitrakadivati 2 tablet TDS, and in diet I give Phand, Dhanyak, Sunti and Satpushpa Phand plus low carbohydrate and zero oil diet. In after that I give Snefan for 5 days with Goguru, that is 25 ml, 50 ml, 75, 150, 200 ml successive first 5 days. After that I give Snen and Svedan. In Snen, I use teal oil extracted from Vetus nigonta and Sisana vintegum, and for Svedan I use Dashmul extract, liquid 15 ml, and I give diet for that 3 days is Mudgavi salad and fruits. After that I give Sneha Virachan of castor oil extract from Vicina cuminis and ginger officinal plus Tirpada powder, and for that I gave diet of Lajamanda. After Virachan I give Sansajangram, I give Sansajangram 7 days, and for the 7 days I gave 2 days Manda and 2 days Peya and 3 days Vilepi. After that I gave 8 days Basti. I use the drug for Basti Shirpak, extract from the Panchatikta for 25 gram and cow milk 200 ml. In that Shirpak I add Panchatikta root 10 ml, honey 10 ml, and Sandava ml to Sandalavan 2.5 gram. In that complete Basti procedure for 8 days I gave diet of Mudgavis, salad, fruit and low carb diet. Next slide. I got results after 28 days. I got results that no pain at bilateral hip joints, no restricted movement at bilateral hip joints, no difficulty in walking, able to stand up from sitting position, able to drive bike, even he is able to kick start motorbike, and he do not face any difficulty while doing his routine job of vegetable selling at market, do not experience any difficulty in forward bending. Next slide. In discussion, as you know that AVN of hip joint develops basically due to obstruction of small blood vessels supplying to femoral head, leading to gradual development of necrosis due to reduced vascular supply. Raktava Strota rather becomes prime cause leading to Asti Dhatu Kshaya in the hip joint. Virechana
Last 1 minute, sir.
Okay, madam. Virechana decrease Raktadushti and also helps in Dhatu Vishodhana. Honey is the first component of Basti, the base in which the emulsion for other ingredients are prepared. It is also said to possess Asti Sandhani properties that helps in rebuilding damaged Asti. Basti with Tikta Dravya, Grut and milk is indicated in Asti Kshaya Janaroga. Guduchi is said to be an excellent Rasayan drug known to prevent aging and degeneration of the tissues, especially Asti Dhatu. Guduchi is grouped under Asti Sandhaniya Mahakashaya. It is also has a role in enhancing Rakta Dhatu. So there may be possibility of providing nourishment to hip joint by development of blood vessels supplying to head of femur. Next. In conclusion, I will say including diet, exercise, panchakarma, and Ayurvedic medicines. In the current case, use marked relief from pain, tenderness, general debility, restricted movement, and improvement in the gait. This Ayurvedic treatment in AVN is cost-effective, non-surgical, need not to admit in hospital, and only herbal products are used. Thank you, everybody. Next slide. These are the process. Thank you.
Very well presented. Dr. Rajeev, sir, if you have questions for Dr. Niran.
I think it's a very good study, and I'm just thinking is from what I understand, you are indicating there is cartilaginous regeneration. Is that correct?
Yes.
So how, again, I'm probably going to ask similar question. How confident, because you have not measured, you are giving this observation based on your perception of reduction on symptoms.
Okay.
How confident you can be that there is actual cartilaginous regeneration? Because that will be the ideal. And the reason I'm saying is that's how it compares. If it is a modern medicine, you measure it before, you measure it after through the MRI, and you know that this was the size, this is the size now, and you know for sure that you are. So in your case, how confident you are that it is actually, because I think it is a fantastic thing if it is correct. So how would you?
Yes. Yes. Hello, sir. Actually, what happened? The patient was very poor, and he was very harassed to do MRI. Actually, there are hip joint surgery of 3 lakh advised by surgeon. So he came in my hospital for further just actually, I got only MRI report previously done in Bhandara. Very big orthopedic surgeon, Dr. Vyas, in Lux Hospital. I'm in rural practitioner in Taluka level, Lakundur. And a patient don't have money. I take only 3,000 or 4,000 for this complete 28 days therapy. Even he didn't do any investigations too. So I don't. Patient didn't do that any further MRI, further investigation. But since last 6 to 8 months, even in follow-up, patient didn't come to my hospital. He actually very happy. But I also asked him that you should do in further investigation like MRI if there is in cartilage, but he don't have money. But in one case, I actually totally surprised that before 8 or 10 months, he cannot even sit on bike and he cannot do any work in vegetable selling that he was in the market by on bike. Now he can kick his bike too. So since last 8 months, he personally isolatedly doing his work with any pain, no air, no any hip joint. So I assume that there may be some possibility of regenerations in cartilages in hip joint. But I don't have any proof for that, like MRI, CT scan. So sorry about that, sir. Thank you, sir.
That's
Thank
fine.
you very
Thank you.
much. Thank you, sir.
Thank you.
Dr. Omkar, sir, if you have any questions for Dr. Niran.
Yes, so Dr. Niran, you smile fantastically and you have transformed, you have transferred your smiles to the patient too, because at the end of the day, for every doctor, you all should ask a question, have I earned for the day? And if you have earned smiles for the day from frustrated patients, hats off to all of you, right? So first and foremost thing, fantastic results in 28 days to get a patient who is basically not able to perform his daily routine work and to get him back on track, and that to a patient who is financially a weak person. So you have charged very less. There is a shlok wherein all the Ayurveda graduates will believe Chikitsa Nasti Nishfalaha. So all of us definitely are working so hard to get results to the patient. It's not always the money which we are earning, it is the blessings from the patients too. And the results, obviously, they speak a lot about the doctor's efforts taken behind such kind of results. Now, Tikta Kshira Basti, which actually you have used in this patient, basically it is the Chikitsa Sutra of Asti and Majjava Srotasa. So what the diagnosis which you have done, may it be on the MRI report or the signs and symptoms of the patient, obviously the efforts which you have taken are superb. Just one question in that, what was the logic of Ruksha Udvartan at the start of your treatment for the first 5 days? I could understand each and everything further, but what was the logic of Ruksha Udvartan in the first 5 days? If you can just throw some light on that.
Yes, sir. Sir, actually, patient has a symptom of stiffness and restricted movement of hip joint. So I guess that there is auron of kapha and meda over vata. That can be considered. So I gave Rukshodvartan in that patient, and sir, I was surprised after 3 setting of Rukshodvartan, patient got 30% relief from his pain. So I confirmed my diagnosis that there must be avartan of meda and kapha on bath, sir. So I gave Rukshodvartan for 5 days. Okay, thank you.
Perfect. And then further, you after the Ruksha Udvartan, obviously you will have some kind of a Vata Vruddhi and you shifted on to
Yes.
Gobruta. That was
Yes, sir,
the
right.
methodology. Superb. Fantastic
Right.
results, Dr.
Thank you.
Niran. Superb results. Over to you, Jinal madam.
I'll invite our next presenter, Dr. Mayuri Supare. Madam, the mic is all yours.
Mentors.
Yes, ma'am. Please go ahead.
I'm audible, ma'am.
Yes, ma'am, you're audible. Please go ahead.
I'm Dr. Mayuri Supare from Madhavbag, Nanded City, Pune Clinic. I will. एक minute, ma'am. My PPT contents are research question, case detail, diagnosis, treatment, and discussion.
Yes, ma'am, please go ahead. 1 minute is over.
My PPT objectives is role of Ayurveda treatment in ischemic cardiomyopathy and type 2 DM. When the patient is come 72-year male patient, known case of DM HTN with ischemic cardiomyopathy and on irregular medicine, this patient not taking any medicine regularly, and suddenly he hospitalized in November 2022 with the complaint of breathlessness and acute decompensated heart failure, and his EF is 10 to 15%, and FDG PET is done there via 8 minutes, ma'am. Viability, sign of LVDP, evidence of impact involving apex, apical, and anterior with no viability. And when the discharge, that 2D echo shows the EF 20 to 25% moderate septococcal, JLS score was -7.4, apico anterior and inferior scar is there, posterior wall subendocardial scar is there. Case description, 72-year male patient known case of hypertension, DM with ischemic cardiomyopathy and not on regular medicine, recently hospitalized for breathlessness, ADHF 10 to 15% EF with global hypokinesia. Come with the complaint with itching all over the body and tingling numbness to the all parts of the body, especially at sole and hand. His height is 157, weight 50.95, BP 11663. HbA1c is 7.4, creat is 1.53, urea is 68.1. 6-minute walk test when we done. Patient cover 234 meter, VO2 max is 115. Then diagnosis is DM, hypertension, ischemia cardiomyopathy with EF is 20% with GLS score is -7.4. Oral medication, combination of Gudmar Haridra Amalki for DM and Arjun Shirpak and combination of Gokshur Haridra Amalki for ischemia cardiomyopathy. High and diet will given high ORAC value 65,000 unit per day, vitamin C 45 less calories, portion control diet, which help to reduce the cholesterol level. Panchakarma Snehan with the 2% of lavender, Tiltel Siddha with 2% of lavender oil, Swedan with Dashmu Kadha, and Anuvasan Basti by Tiltel with contents of Gokshur, Haridra, and Amalki. This new technique with drip-wise method we used. Our baseline treatment of this patient is Snehan Swedan Anuvasan Basti for 7 treatment. Ayurvedic medicine and diet reduces the DM and ischemia. Follow-up treatment, his EF was very low, so we replaces Basti with Arjun Kadha for 7 treatment. Follow-up his increased EF, follow-up that treatment, and then added a Vincol Churna. Result was in December 22, HbA1c is 7.4. Now March 23, HbA1c is 6.2, and stop all OHA of that patient. EF was 20 to 25%. Now EF is perfectly 25%. VO2 max is improved from 11.1 to 18 to 15.98. LDL is 114 in December 22 reports. LDL decreased 104. Most significant is HDL is increased from the previous report is 51, and in 2D echo with GLS report shows apex and apico anterior scar in previous report that was not seen in latest report. Discussion in Krusha Pramehi and Vataj Rudrak patient. When we reverse the diabetes, we improve heart health with the help of Anuvasan Basti, improve the circulation to heart and improve the ischemia. Anuvasan Basti drug, Gokshur, Haridra, Amalki. All drugs are nitrodilator, help to secrete endogenous nitrous oxide. Haridra, Amalki are rich in antioxidant, which improve the endothelial dysfunction.
Ma'am, I would like you to conclude your slide.
Conclusion, in Krusha Pramehi patient with ischemia, we provide low carb, high ORAC value diet and Anuvasan Basti. We improve the ischemia, cardiomyopathy and VO2 max. Thank you, ma'am.
And Dr. Rajeev sir, if you have questions for the presenter.
I think this is a good study. So if your theory is correct, what proportion of heart attacks can be prevented? Can you hear me?
Yes, sir.
उससे कितना फायदा होएगा अगर सबको ये देने लग जाएंगे पूरे हिंदुस्तान में, तो क्या होएगा?
Sir, we actually EF was improved and HDL was improved. So we're not sure that the heart attack we improve, but in 50% cases, if we follow the diet and exercise regularly, then that treatment are increased our blood vessels level, so we improve heart attack also.
Thank you.
Dr. Omkar sir, if you have questions for the presenter.
Yes, Dr. Mayuri, fantastic results, but I think this case needs even more evaluation, as the EF earlier in the first slide, as you told, was 10 to 15%, and after the treatment, it's now 25%. So still the patient is in a failure mode.
Yes, sir.
Right?
But patient symptomatically almost improved.
Agreed. No doubt about that, because you have given a very good result in the HbA1c2, 7.4 to 6.2, and all the medicines have been stopped. So whether any OGTT test was done of this patient?
No, sir.
Fine, but all the anti-diabetic medicines have been stopped.
Yes.
Okay. So whether this patient is still under treatment or is his treatment over now, since 25% is the EF?
Treatment is still under process. We will work on EF and GLS score also.
Fine. So have we suggested any water restriction to the patient from the first day of the treatment?
Yes, sir. From first day, we restricted his water up to 1 liter. Actually, up to 800 milliliter from first day, then 200 ml because of summer season, we increased.
Okay, so symptomatically the patient has improved. There are improvements in the parameters of the patient. So overall, this is a fantastic case presentation. Good job done, Dr. Mayuri.
Thank you, sir.
Yes, Dr. Jean.
I would now call upon Dr. Nilima Kandagle for her presentation. Dr. Nilima, we are waiting for you.
Good afternoon all. Myself Dr. Nilima Khandagre from Mini Clinic Sakar. Today, may I request Pallavi ma'am to share the PPT? Thank you. Today I'm going to present a case that is impact of Ayurvedic treatment on cardiac biomarker NT-proBNP for heart failure. Next, please. There are several patients of chronic heart failure. So I want to know that can we reduce cardiac biomarker NT-proBNP in heart failure patients with Ayurvedic treatment? Next, please. A 74-year patient's age is 74, gender is male, history of diabetes with CHF, with HTN and CKD. A 74-year-old male patient from Pune who is a retired teacher having history of diabetes since last 11 years and hypertension since last 16 years with a chronic heart failure and chronic kidney disease. Patient came to clinic with complaints of dyspnea on exertion and pedal edema and fatigue. Next, please. Patient details: known case of diabetes type 2, hypertension, chronic heart failure, and chronic kidney failure. Age 74, height 166 centimeters, weight 66.3 kg, abdominal girth 102 centimeters, and he has history of ISD. He has in 2011 he has MI, and he is treated. He taken treatment in Madhava Khopoli. Now his present complaints are dyspnea on exertion, pedal edema, and fatigue. Investigation done are HbA1c, NT-proBNP, serum creatinine, EGFR with RFT, and investigation advised are HbA1c, NT-proBNP, serum creatinine, EGFR, RFT, and 2D echo. Next slide, please. Diagnosis is DM with HTN with chronic heart failure with chronic kidney disease. Next. The patient is treated with oral medications like Punarnava, which is Punarnavam Karoti Iti Punarnava, which is a diuretic, Shofahar, and anti-inflammatory. Arjun is cardioprotective, cardiotonic, and contains coenzyme Q10. Vacha is nephroprotective and hypolipidemic and neuroprotective. Gokshur is also Mudral. Vibhitak is Deepan, Pachan, Anulomak, and Krumigna. Erendatel Siddha with Trifla and Shunthi, which is Anulomak, as well as if it is given in small doses, it is anti-inflammatory, and it increases plasma to lumen clearance of urea and creatinine. Haritaki is a Shrestha Rasayan, the Dhatri Nishayog also given to the patient. Diet: 800 kilocalorie diet with low carb, moderate proteins, and moderate fat was advised to patient. Snehana done with Arjun and Nirgundi Siddhatail, Swedan with Dashamukwar, Basti with Arjun and Punarnavakwar. Rudhadhara given with the help of Dashamukwar. Total 14 sittings of Panchakarma were given. Arjun used in Basti and Snehan reduces palpitation. It is anti-inflammatory, anti-hypertensive, cardioprotective. Ruddhi by Prabhav. Arjun improves the blood circulation to heart, improves the heart's strength to pump the blood, improves endothelial dysfunctions, and calms down the hyperactivated sympathetic nervous system. Thus, it improves the chronic heart failure. Next, please. Here are the parameters of the patient. Before it is height of the patient is 166, weight of the patient initially 66.3, now it is 59.9. BP initially is 158/80, now it is 114/70. Abdominal girth 102, now it is 89. HbA1c is 10.8, now it is 5.7. NT-proBNP is 2339.25, now it is 533. Serum creatinine is 1.78, now it is 1. eGFR is initially 40, now it is increased, it is 81. HDL is 29.8, now it is 32.3. Urea 105.34, now it is 42.03. BUN is 49.22, now it is 19.64. And GTT, previously it is positive and now it's negative for 2 times. Initially there was dyspnea and exertion, now there are no such complaints. Next, please. When a patient having diseases like diabetes, hypertension, chronic heart failure, chronic kidney disease is treated with Ayurvedic treatment such as oral medications and Panchagavya therapy, patient's sugar levels came to normal and his diabetes is reversed. Patient's GTT is negative. Patient's cardiac biomarker, NT-proBNP, came to normal within 2 months. Patient GFR is increased to 40 to 81. Serum creatinine is reduced from 1.78 to 1. Patients' complaints such as dyspnea and exertion, pedal edema are subside within a short span of 2 months. Next, please. Due to Ayurvedic Panchakarma and oral medications, patient's cardiac biomarker, NT-proBNP, came to normal. His GFR is increased and his diabetes get reversed within 2 months of period at the age of 75. Next, here I've attached some reports of a patient before and after. Next. Next. His glucose, his GTT, initially fasting is 82, then after 1 hour sugar level is 110, and after 2 hours it is 79. So patient is GTT negative now. Next. Thank you. And special thanks to my mentors and Mahesh sir. Thank you.
Thank you, madam. Dr. Rajeev sir, questions for the presenter?
Yeah, so I think it's really good. My question is that if you replicate the same in some other patient, will you get the same results?
Yes, sir. Now there is one patient. Now his EF is 40%, and I'm doing the same treatment, and I'm getting the result.
Fantastic, because it will be good to have a long case series, and that may be able to give a stronger evidence. So I think that's good. Thank you.
Thank you, sir.
Dr. Omkar sir, if you have questions for Dr. Nilima.
Yes, first of all, Dr. Neelam, many congratulations. This is an awesome result which we have got. Not only in the NT-proBNP from 2339 to 533, this is a great achievement, as well as the patient at the age of 75 is rid of diabetes. Now I am diabetes free. That psychological disturbance which he has had since so many years, I am diabetic, I am diabetic, I am diabetic. Now he is diabetes free. So that pleasure which a person gets after getting his disease reversed is something you can't compare it in any kind of, money or words. But definitely this patient will be a bhakta of you now. And whatever you are going to tell him, he is going to follow it blindly, right? Because all his issues like pedal edema, DOE have come to a standstill, and now he's completely off that CHF failure mode, right? As well as his diabetes has also gone down. The best part is his GFR has also improved from 40 to 81, and serum creat levels from 1.78 to 1. So overall, it is a fantastic presentation, super results, and wish to see many more results from the same methodology in n number of patients which you see further. Best wishes, doctor. Best
Thanks,
wishes.
sir. Thank you, sir.
Thank you, everybody. Next, I call upon Dr. Kirti Mahajan for the presentation. Stage is all yours, Dr. Kirti.
Hello, good afternoon, everyone. Ma'am, am I audible?
Yes, yes, doctor. Go ahead.
Okay. I'm Dr. Kirti Mahajan, clinic head Nandurbar Mini Clinic. Objective is to study the efficacy of Jethil oil, Zatyadi Tel, local application along with Panchakarma, Anuvasan Basti, Sarvanga Snehan Svedan, diet in non-healing diabetic wound. Patient medical history was a male patient 61 years old from Shahada, Taluka Nandurbar, Taluka district Nandurbar, known case of DM since 20 years, on treatment injection insulin Mixtard 3070 15 unit BD, non-healing diabetic wound on left leg since 3 months, taken treatment from multiple surgeons, dressing and oral antibiotics. A male patient of 61 years, height 166 centimeter, weight 58.2, BMI 21, abdominal girth 89, BP 110/70. Present complaints: non-healing wound on left leg, burning and tingling extremities, local swelling, pain, generalized weakness, fatigue, unable to walk without support, and HbA1c was 12.2. So my diagnosis: uncontrolled type 2 DM with non-healing diabetic wound. Treatment: oral medication, tablet containing combination of Daru Haridra, Amalaki, 2 tablets BD before food, Kadha containing Meshashungi extract, Guduchi 20 ml BD before food, Erenta tel containing Amalaki, Bibitaki, and Shunthi, 25 to 30 ml with warm water early morning. Diet kit containing 800 calories per day, low carb, moderate protein, moderate fat, and Panchakarma, Sarvanga Snehan with neem tel, Svedan with Dashamul Kada, Quat, and Anuvasan Basti in Uttam Matra, 240 ml containing Ashwagandha, Ela, Gokru, Bala, Atibala, and local application of Zatyadi tel 3 times a day with cotton pichu. Results: patient started feeling well after first Panchakarma only, and he came without support on day 7 for next Panchakarma therapy. His weakness also reduced significantly. The wound healing was very fast, and within 15 days, the wound healed. In 4 months, the HbA1c came down to 6.9 with reduced insulin dose to 5 unit BD. So this is wound progress. Discussion: Daru Haridra is known for its Abhishandi Nashana property, hence recommended in Vrana Prameha. It is anti-hyperglycemic, reduce insulin resistance. Amalaki is having Vrana Ropana, Krimigna property, hence recommended in Prameha Shota. It increases sensitivity of peripheral tissue to insulin, prevents lysis of insulin, and prevents tissue from oxidative damage. Haridra is anti-inflammatory, so it activates beta cells, provides micro and macrovascular complications. Guduchi and Meshashungi from Kadha digest and drips up arm, plague, and kapha. Meshashungi promotes regeneration of beta cells. Guduchi reduces oxidative damage to tissue, protects from cardiovascular complication due to diabetes. Zatipatra from Zatyadi oil provides protection against free radical molecules and oxidative stress. Bioactive molecules like lipocollagen and glavadrin from Nimba and Yashti Madhu are useful in wound and ulcers. Anuvasan Basti with oil having ingredients like Ashwagandha, Ela, Gopru, Bala, Atibala is helpful in Vata Shamana, hence decreasing fatigue, weakness, and local pain at wound site.
Ma'am, sorry to disturb you. Last 1 minute.
Triphala and Shunti is useful in Pitta Shamana, hence reducing local wound swelling reduces. Also the Snehan Svedan with neem oil and Dashamul Kwat reduces Vata, Pitta and Kapha. So my conclusion is non-healing wound due to diabetes is a complex and chronic disease due to long-standing uncontrolled blood glucose levels. To cure such wound, Ayurvedic oral medicines along with diet, panchakarma, and local wound care with Zaktadi oil is very effective. So this is patient testimonial. Thank you all.
Wonderful presentation, ma'am. Dr. Rajeev, sir, if you have any questions for the presenter.
I think it's quite good. Again, probably similar question that in diabetes, there are so many other things they are used. How would you think is your method compared to any other method?
Sir, if glycemic control is occurs, so wound healing is quite faster.
Okay, fine, thank you.
Dr. Romkar, sir, if you have questions for the presenter.
Yes, Dr. Kirti, congratulations. The image of the wound which you had shared on the first day and the last day, it's self-explanatory. And the HbA1c reduction from 9.8 to 6.9. That's really nice. And I feel that further too, our aim is not that only the wound has healed and now the patient is still diabetic. Our aim should be that the diabetes of the patient is reversed. So the HbA1c, unless and until it doesn't come less than 6 or most probably by 5.7. So we should not rest, and we should make sure that the patient follows all the Pathya as mentioned in the Prameya Rog Chikitsa Adhyay, as well as whatever we are doing in Madhobag, so that the relapse of such kind of an diabetic wound doesn't occur. And overall, the methodology which you have used, only one question, was any Vrana Shodhana done before the Vrana Ropan Chikitsa was initiated by? Whether any debridement was done or whether any kind of a medication was used locally for Vrana Shodhan?
Sir, I use Triphala Kwat for Vrana Shodhan.
Okay. And how many settings of, Triphala Kwat Vrana Shodhan were done and further Jatyadi Tel application were done?
Sir, 3 times in a day.
3 times
At
in a day.
home.
Fantastic. Fantastic. Really nice results. Congratulations, Dr. Kirti.
Thank you, sir.
Yes, Dr. Jean.
Next, I would like to call upon Dr. Sampada Korde. Dr. Sampada, ma'am, the mic is all yours.
So before Dr. Sampada starts, I will just like to tell all the presenters who are going to present that many of you have mentioned a lot of words in the slides. Now, as a viewer, when we see slides, it is the point which has been highlighted that needs to be taken care of. So if you are mentioning all the parameters in the same text format, then I think that, the highlighting aspect is missing. So instead of, investing time in mentioning the height of the patient, weight of the patient, tell whatever is precise in that slide so that we can have our attention on that precise point, right? We can save time and then have good time for discussion. Okay, Dr. Sampada, best wishes.
Good afternoon, everyone. I'm Dr. Sampada Korde. I practice in Fonda, Goa, Madhobag Clinic. Today, I'll be sharing a fantastic case of Ayurvedic management of CHF with low ejection fraction. Next. So, congestive heart failure or CHF is when your heart is not able to pump enough blood to meet body's needs. Less than 40% EF, that is when blood pumped out of the heart's left ventricle with each contraction is less than 40%, it can go into heart failure. Congestive heart failure symptoms like shortness of breath, cough,
sometimes weight gain is felt, swelling of feet, ankles, and legs, and tiredness or fatigue are generally experienced by the people. CHF is rising at a very high rate, and it most of the times goes unnoticed. Next. A case, a patient named Mr. Santosh, age 64 years, approached us on 5th of March 2023. He had symptoms of occasional chest pain and discomfort, chest heaviness, and grade 2 dyspnea on exertion. He had diabetes since 15 years, and since 1 year, he was diagnosed with HTN, chronic kidney disease, CHF, and IHD. Next. So the investigations which the patient had already done because he was once admitted were 2D echo, which showed hypokinesis of anterior septum, apical septum, apex, middle inferior wall. LVF was just 35% with grade 1 mitral and trivial regurgitation. His angiography also showed 90% of blockages in LAD and RCA. Blood reports, serum creatinine was 2.6. HbA1c was 8.6%, FBSL 227, and PP was 404. Next. So the diagnosis were CHF with IHD, with DM, HTN, and CKD. Prakriti was Pitta Vata Pradhan. Dosha Pradhanya was Pitta and Kapha. Dushti was mainly noticed. Dusha were Rasa, Rakta, and Meda. Next. So the chikitsa which we started with was Panchakarma chikitsa, which was done twice a week, 90-minute sessions. So total 14 sessions were done. Snehan with centripetal oleation with Arjun Siddha oil. Swedan was done Peti Swed steam bath with Dashmul Kada. Basti enema was given 90 ml with Arjun Siddha Kada. And Hriday Dhara was done with Dashmul Kwat. All the treatment was aimed at balancing the doshas, Agni Vardhan, and removing Srotodushti. Next. Medicine formulations with Arjun, Punarnava, Gokshur, Varun, Guduchi, Amlaki, Daru Haridra, Erend, and Triphala were given to him, mostly which were Mutral, Shotagnam, Srotorodahar, Kapha-Pitta Nashak, and Srotorog Nashak. Next. So the ahar which was advised was Lagu and Ruksha ahar. He was strictly told to eat only when he feels hungry and drink only when thirsty. All Ayurvedic diet principles were told to him. Low carb, low calorie diet with almost 50,000 ORAC value, high protein and low sodium diet was given. Next. Bihar, he was told to follow Ayurvedic Dinacharya, daily yogasanas 30 to 45 minutes, pranayam, anulom, vilom, brahmari, deep breathing, meditation, and walking daily, minimum 30 minutes. Next. So the allopathic medicines which we was taking, Ecosprin, Telma, Metformin, Lasix, Rosuvax, were all tapered after the 60 days. Only Ecosprin is still continued. Next. The results which we got after 2 months of treatment, patient is feeling fresh, active, and energetic. He is having positive attitude towards life following Dinacharya, Rutucharya. No dyspnea on exertion, no chest heaviness, patient is happy. If we see parameters wise, weight has decreased from 58.5 to 53.5. His BMI has decreased, but with due course, we will give him some Rasayan medicines. Abdominal girth has also decreased. Blood pressure 140/90 to 124/66. Next. Investigation specifically GFR was increased from 30 to 67, blood urea 38 to 34, creatinine has decreased from 2.6 to 1.2, and his HbA1c has decreased from 8.6 to 7%. Next. 2D echo reports which showed hypokinesis of almost most of the segments. Now it is non-dilated, non-hypertrophied left ventricle, minimum distal anterior septum hypokinesis with LVEF 60%. Other cavities are normal and mild mitral regurgitation is there. Next, please. So the discussion, the Sabhrapti Vedan was done using principles of Deepan, Pachan, Vata Muluman, and Vata Shaman, Pitta Shaman, reducing the fluid overload, improving blood circulation, and good glycemic control. So the conclusion is within 60 days of treatment, Ayurvedic management using proper medicine, Panchakarma, proper diet and exercise certainly helps in improving the heart's blood supply function and capacity, not only heart, but diabetes as well as hypertension, and his creatinine levels were back to normal. chances of survival as well as quality of life has decreased of the patient. Next. Thank you.
Wonderfully presented. Dr. Rajeev, sir, if you have questions for the presenter.
So I think it's quite good depiction of the improvement in the cardiac function through this. So how would you think that this all has happened? Because you have used many things. Do you think there was one better than the other that has caused contribution to, say, for example, improvement in renal function, improvement in the cardiac function, or the diabetes?
So
Is
in
there any
fact, all the factors we tried to maintain so that in one go all the factors were balanced, like Snehan Swedan, which helped him with the cardiac functions, with the kidney functions, or the strict diet helped him in controlling his portions or eating again and again or eating anything which he got. Also the regimen, especially pranayam, and help him to reduce the stress. He was a pitta prakriti kind of person, so that helped him calm down. So the ventricles must have been relaxed, and the system has started responding him very nicely.
Thank you.
Thank you.
Dr. Omkar, sir, questions for Dr. Sampada?
Congratulations, Dr. Sampada. Just one question. What was the water restriction given to this patient?
Usually he was drinking not a very lot of water, but two things we had explained to him: just drink only when you are thirsty, drink little by little, and maintain 1 liter bottle. If you finish it and if you still feel thirsty, and if you are frequently urinating, then you may have another 500 ml of water.
Okay. And EGFR has gone up from 30 to 67, HbA1c from 8.6 to 7. Serum creat is also lowered down. EF from 35 to 65 in a span of 60 days. This is superb. You've taken a lot of efforts to get so fantastic results to the patients, and I really wish you best of luck for treating such kind of patients in future. Best of luck.
Thank you. Thank you, sir.
Yes, Dr. Jeevan.
Next, I would like to call upon Dr. Trupti Tijare for her presentation. Dr. Trupti.
Good afternoon, everyone.
Good afternoon, ma'am. Kindly proceed.
Thank you, Pallavi ma'am, for sharing PPT. Now it's a case presentation of Ayurvedic management in case with type 2 DM. Myself, Dr. Trupti Tijare, Akola Madhava Clinic Head. Now the objective, why this case study is selected, because the patient was unable to walk because of both legs. He was not able to balance himself, unable to do exercise. So according to Ayurveda, the etiology of prameha is ase sukham sapna sukham dadini gramya dakanupam avsarasaha payamsi navanna panam gudavekrutam cha prameha hetu kapakrucha sarvam. That is over indulgence in pleasure of sedentary habits, excess sleep, excess curd, excess meat, milk and its preparation, freshly harvested food articles, freshly prepared drinks, preparation of jaggery, and all kapha aggravating factors are responsible for the causation of prameha. And this case was specifically having all these causative factors. So in this case, Nidan Parivarjan was not so easy. Next. Case description was 59-year male patient, known case of type 2 DM since 5 years, family history, DM2 mother, complaining of bilateral knee joint pain, imbalancing while walking, and polyuria. Diagnosis was type 2 DM and Januarum. Next. Patient details. Patient was having type 2 DM since 2017. Patient was having complaints of knee joint pain since 7 to 8 years, imbalancing in walking, while walking since 4 to 5 years, and nocturnal polyuria. On examination, on day 1, the patient's random blood sugar level was 168, weight was 89.5, height was 161 centimeters. So the BMI of patient was 34.3 and abdominal girth was 119 centimeters. Jiva was Sam, Malabadhata, Mutra, nocturnal Bahumutrata was there, Shuddha was Prakrut, Nidra was Ati. Rombok test performed, it was positive. SLR For right leg, it was negative. For left leg, it was positive at 60 degrees. Next, investigations done. On day 1, HbA1c was 8.6%. Serum calcium level was 6.1, which was low. Serum sodium was 134. Serum potassium was 3.4. And serum vitamin D was 24, which were normal. Next, so the diagnosis was type 2 DM and Januarium. Next, now the treatment information with product details. Oral medications given was Erand oil Murchit with Tripara for Viration, Amalaki Haritra, Daru Haritra, Mesha Shrungi, and Guduchi, which is helpful in Prameha Chikitsa. Gomutra Haritaki to reduce down the inflammation, Mesha Shrungi and Guduchi Kadha, then Laksha, Asti Samhara, Arjun, Ashwagandha, Nagbala, Gugur to treat degenerative arthritis, Shatapushpa, Shunti, Haritaki, Swarnapatri, Saindav Lavan to relieve constipation, and Vishagarbha oil was given for local application to patient. Diet advised was low carb diet of 800 calories only. Exercise was daily exercise for 30 minutes. After 45 days of starting treatment, patient was able to walk 20 minutes a day. Panchakarma, oleation with neem oil for 30 minutes, steaming with Dashmur Kada for 10 to 15 minutes, and per rectal drug administration of Gudmar, Daru Haridra, and Yashti Madhukwat once in a week. Next. Improvement with timeline, we can see on day 1, the patient's HbA1c was 8.6, weight was 89.5. So the BMI was 34.5, and allopathy medicines, there 3 molecules were there in the patient's treatment. On day 30, the HbA1c was 6.3, 50% allopath medicines were tapered. On day 60, the HbA1c was 6.7 and 75% allopath medicines were tapered. But on day 90, HbA1c was 6, patient's BMI was 27.7, and no allopath medicines were there. So after 90 days, GTT was performed, which was negative. After 240 days, patient HbA1c was 5.8, and now it's 522nd day. Patient is with me. His HbA1c is still 5.8. Weight is 69 kgs. BMI is 26.7, and his GTT recent is negative. Next. So the discussion now how this happened. Oral medication and Panchakarma therapies along with exercise was strengthening exercise for quadriceps, hamstring and gluteus muscles, barefoot walking, and when the patient started walking, correct training for standing, balancing, weight transferring and walking was suggested. On day 30, when patient was able to walk a little, patient was so happy that he can walk now. Next.
Last 1 minute, ma'am.
This is before and after pictures of patient, and correction in knees, inflammation was reduced. Next. This is recent GTT report on day 1. On day 522nd, fasting sugar level was 96. After 1 hour, it is 208, and after 2 hours, it is 190. Next. So the conclusion is Ayurveda treatment and lifestyle modification can reverse type 2 DM completely. Here, patient's life quality is improved. So the patient's life quality can be improved with Ayurveda medicine, Panchakarma management, and exercise with integrated approach. Thank you.
Thank you very much, ma'am. Dr. Rajeev Gupta, sir, if you have questions for the presenter.
I'm okay.
Dr. Omkar, sir, if you have questions for the presenter.
Yes, since 3 days, we have been seeing so many cases wherein the treatment is maximum of 1 year. But Dr. Trupti, really hats off to you. Day 522nd, GTT is negative and the patient is following whatever you are telling the patient to follow. That's a great achievement for you. And as well as there are a number of doctors who are seeing these presentations. I do believe that if you guide the patient for a proper lifestyle and make him realize what mistakes he had done in the earlier life before he came to you, and the patient, if it doesn't follow those same mistakes and does whatever you are going to tell him, and if he gives 100% commitment, this is what you get at the end of the day. So day 522, GTT negative, HbA1c 5.8 speaks a lot about your efforts and the efforts of your team. Best wishes, no questions at all. Super.
Thank you. Thank you very much, sir.
Moving on to the next presenter, Dr. Kalyani Bellorkar. Dr. Kalyani, the mic is all yours.
Good afternoon, all. Am I audible?
Ma'am, you're audible, but your video is not visible. Yes, ma'am. Yes, ma'am.
Is it okay?
Yes, go ahead, ma'am.
Objective of today's case is effective of Bruhan Chikitsa in low BMI diabetic with a Panchakarma and lifestyle modification. A 38-year female in 2070 was suffering losing weight, loss of stamina. In 2018, she diagnosed DM, start anti-OHA but raised blood sugar and progressive weight loss. Unable to perform daily activity also. In 2022, injection insulin, long acting as well as short acting, both starts, but BSL still raised. Complaints: raised blood sugar, generalized weakness, itching all over body, dryness, nocturnal micturition, lack of stamina, unable to do daily activity, weight loss, disturbed sleep. During assessment, weight 43 kg, BMI 18.4, blood pressure 100 by 60 mmHg, pulse 17 per minute, SpO2 98, abdominal girth 78, HbA1c 13.4, fasting blood sugar is 313 and post-meal blood sugar is 320. Fasting insulin 3.77 international unit per ml and GDA antibody 137.3 international unit per ml, and it is positive. The diagnosis of this patient, a low BMI DM with a sarcopenia, diagnostic measures of sarcopenia with a walking speed 0.8 meter per second, with 4-minute walk test, and hand grip should be tested. Treatment plan: a Bruhan Chikitsa with Panchakarma and lifestyle modification. In oral medication, Meshashungi extract, Amalki extract, Haridra extract, 500 mg BD, Kumari Asav 20 ml BD, Balya protein, protein powder which is made up of emmer wheat, barley, roasted chana dal, ginger, cardamom, 15 gram BD. Diet: 800 kilocalorie diet with a low carbohydrate, high protein and good quality fats. Also daily 20 ml ghee BD, 15 gram goat meat once in a week. In Panchakarma Chikitsa, Snehan with 100 ml Azadirachta indica, that is the neem extract processed in sesame oil. Duration of this therapy 20 minutes. Neem contains compound nimbindin. It significantly decreases blood sugar level and prevent adrenal as well as glucose included hyperglycemia. Neem oil local application helps to improve circulation, mobilize subcutaneous fat deposits, protect skin from infection, allergy, and skin diseases. Also protect skin from various infections and to improve healing of minor bruise and soreness. In Sweden, a passive heat therapy to the body with Dashmul. Duration of this therapy 15 to 20 minutes, 3 to 4 minute relaxation after procedure. Sweden calm downs hyperactivated sympathetic nervous system, reduce peripheral resistance, and improve elasticity, endurance, reverse sarcopenic changes also. In Basti, use oil per rectal drug administration should be in body for 40 minutes for maximum absorption. 240 ml sesame oil processed with ashwagandha, ela, gokru, bala, atibala. Duration of this therapy was 30 to 40 minutes. Ashwagandha, it is a good Bruhan, Balya and potent. Vata Shamak, also effective in all types of Vata Vyadhi, neuromuscular disorder, debilities, stress, and oxidative degeneration. Gokshur improve intrinsic and extrinsic nitric oxide secretion in coronary blood vessels, reverses vascular complication in low BMI DM patient. Bala, it is the antioxidant, anti-inflammatory, analgesic, neuroprotective, hepatotoxic, and aphrodisiac. Exercise for reversing sarcopenia, cardio exercise 10 minutes, weight training 20 minutes, balancing 10 minutes, respiratory 10 minutes. Time duration increases with the comfort and effort tolerance capacity of the patient. Treatment plan of Bruhan Chikitsa. Baseline treatment, HbA1c was 13.4, weight 43 kg, BMI 18.4, and sarcopenia present. Bruhan Chikitsa start 4 Panchakarma sitting once in a week, 30 days follow-up, 60 days follow-up, and after 90 days follow-up. Most of low BMI diabetic with sarcopenia, patient treated with injection insulin, short-acting and long-acting, but generalized weakness, loss of stamina, progressive weight loss, raised BSL persist, while patient only depend on injection insulin, showed a marked decrease unit of insulin. After a treatment that is a 90 days treatment, the level of HbA1c were significantly reduced. Patient BMI and weight raised after 90 days. The baseline
I would like you to conclude.
After 90 days, 49 kg, BMI 20.9 kg, HbA1c reduced, it is a 10%, and sarcopenia reversed. For low BMI DM with a sarcopenia management by Bruhan Chikitsa and Panchakarma with 240 ml Anumasan oil, basti, low carb diet, high protein, good quality fat, exercise, all are act by reducing sympathetic stress, reduce sympathetic action, lower hepatic glucose production, which can be helpful to reduce blood sugar level, improve vascular health, growth muscle mass, and improve stamina. The conclusion of this study, there was a significant improvement in HbA1c, weight gain, improve muscle fiber quantity and quality, reverse sarcopenia after a Bruhan Chikitsa, Panchakarma, and lifestyle modification. Thank you.
Dr. Rajeev Gupta, sir, if you have questions for the current presenter. Rajeev, sir, if you have any questions for the presenter.
Dr. Jinal, may I?
Yes, sir.
Yes, Dr. Kalyani, fantastic results. Because getting results in a low BMI patient is, it's a big challenge. And you have actually from 18.4 BMI, the patient's BMI has gone to 20.9. So that's a good achievement. Whatever medications you have used for the mouse Vardhan have really worked. And I just wanted to know whether any dynamometer test was done. You had mentioned regarding hand grip, but whether any dynamometer evaluation was done pre and post to find out how the sarcopenia has reduced down.
Not dynamometer. I use a 20 kg. It is a standardized principle. In woman 20 kg weight and in male 30 kg. Patient unable to carry this 20 kg weight and walking speed 0.4 meter per second. 0.8 meter per second in 4-minute walk test. She also unable to walk to complete this test. After treatment, she carried 20 kg weight and daily walk 2 kilometers.
Okay. Was there any symptom of fatigue mentioned by the patient earlier, and after your treatment, this symptom of fatigue was reduced or vanished?
fatigue was reduced.
Okay, so HbA1c is also from 13.4, you have got it up to 10. Whether the insulin has been stopped of this patient?
Insulin not stopping, but insulin was tapered up.
Tapered down. Good. Fantastic. Fantastic. I think all the participants over here know about sarcopenia. We can compare that with Mausakshay, and medications will obviously are meant to build up the rasa, rakta and mausa dhatvagni of the patient.
Yes,
So the
also
treatment.
50 gram goat meat daily basis.
Perfect.
Once in a week.
Perfect, perfect. So the Upay Yojana, the methodology used by you is good. Otherwise, the BMI won't have improved, and symptoms of sarcopenia, fatigue wouldn't have been reduced. So fantastic results, Dr. Kalyan.
Thank you, sir.
Yes, Dr. Jeannie.
Dr. Rajeev, sir, if you have any questions for the presenter, if not, we can move ahead. I think we can move ahead, sir. Next, before I call upon the next presenter, I would like to remind both the chairpersons to send the scores for the presenters to me on the private message so that we can tally it at the end of the session. Now, I would like to call upon Dr. Rupali Kavre, madam, to share her presentation with all of us. Ma'am, the mic is all yours.
May I start?
Yes, ma'am. Yes.
Please share my PPT. Good afternoon, all dignitaries and my dear friends. I, Dr. Rupali Kavre, is going to present management of stable angina in diagnosed case of myocardial bridging with the principles of Ayurveda and Panchakarma. Myocardial bridge is a congenital condition in which one or more coronary arteries goes through the heart muscle instead of lying on the surface. This condition in many cases may be responsible for adverse complications like myocardial ischemia, angina, acute coronary syndrome, arrhythmia, and even cardiac death. So my objective is to evaluate the effect of Sampurna Hridaya Shuddhikaran on stable angina in myocardial bridging. I had taken the case series of 3 patients. One patient having 65 years male complaint attained to my OPD in 2024 with a complaint of dyspnea at grade 3, effort angina grade 3. Even he can't walk 2 stairs and become dyspneic. His previously he was having a history of HTN since 5 years. History of MI in 2012, and coronary angiography was done, which shows no plug but mid-LAD myocardial bridging. Second case of a dynamic teacher, male patient having complaint of chest pain, admitted to the hospital, coronary angiography was done, no plug but myocardial bridging was there. All these patients are symptomatic. And case 3, a male 47 years patient complaining of dyspnea grade 2, chest heaviness, visited to my clinic. I took stress test was positive, angiography was suggested, and it shows no plug but myocardial bridging. In all these 3 patients, I used Panchakarma, Sampurna Hridaya Shuddhikaran. The Snehan was done with Proceed sesame oil with Arjun, Nirgundi and Dashmula, which reduces the inflammation and induces the peripheral vasodilatation, reduce in systemic vascular resistance. Swedan was done with Dashmul Kath, which reduced the sympathetic tone, reduce increased heart rate and increased BP. Hridayadhara was done with the lukewarm Dashmul Kath, which increases local vasodilatation, reduced dyspnea on exertion. And Basti was administered the Kath of Arjuna and Punarnava, which reduces the lipid level, reduce heart rate and increase the diastolic coronary filling. Then how the Panchakarma will work? Myocardial bridge. Next slide, madam. Next, yeah. Myocardial bridge are most commonly localized in the middle segment of the left anterior descending coronary artery, that is LAD, and even a small thin myocardial bridge, that is 1 mm, can cause a significant symptoms. Thus, it is the hypothesis that what Panchakarma, next slide. What Panchakarma will do in this case, we can see the systole and diastole. The diastolic systole has shown the white line, that is there is no plug but is a myocardial bridging. So our Panchakarma relieves the hemodynamic disturbance caused by myocardial bridge by decreasing the heart rate, increase diastole coronary filling, and remodeling of the coronaries. That maybe that how can the treatment works. Here are the results. Chest pain and effort angina. In first case, it is reduced from grade 1 to no chest pain. VO2 max improved from 6.65 to 18.7. And in case 2, grade 2 dyspnea reduced and chest pain reduced to, he can perform his all work, stress test, he can walk to stress test up to 15 minutes. And in case 3, effort angina grade 2 reduced to occasional, the patient have an episode of chest pain, but it is mild. Next slide, please. In case 1, VO2 max improves from 6.65 to 18.55. In case 2, from 16.8 to 35, that is a normal VO2 max. Stress test is negative. And in the third case, 17.75 to 24.85. And as I said earlier, the complications of myocardial bridge, maybe in the later phase, it may develop accelerated atherosclerosis, which does develop proximal to the bridge segment. But I had a case of where I treated the patient in 2014, and now after 9 years, the patient has become 75 years old, and he can walk 3 kilometers without any symptoms, without chest pain. And this is how we can sum up the conclusion like this: कि Panchakarma can be beneficial to the patient having myocardial bridge to reduce the chest pain, improves quality of life, improves myocardial perfusion, and can reduce risk like arrhythmia and myocardial MI. Thank you. Next, these are the references, and this is my team.
Wonderful, wonderful presentation, ma'am. Dr. Rajeev Gupta, sir, any questions for the presenter? Omkar, sir, any questions for the presenter?
Yes, first of all, Dr. Rupali, this was a very unique case presentation of 3 of the cases which you have treated of myocardial bridge, because this is a very rare entity, and out of 1 lakh patients, you get 1 patient with myocardial bridge. So that's very nice to see the results which you have got. Just one query, whether there are any symptoms in all the 3 patients which were similar?
Yes, all the patient has chest pain, effort angina, or chest heaviness.
Fine. And after the treatment, this symptom has reduced drastically?
Yes, definitely, sir. As we all know, the myocardial bridging, the symptoms depend on how much the bridge, length of the bridge and site of the bridge, actually. But last 2 patients have superficial myocardial bridge, but first patient has long strain myocardial bridge, which requires more treatment. And definitely he had more severe symptoms, like he can't walk 2 stairs. If he could do that, he get dyspneic and chest pain. And now all the symptoms are relieved.
Fantastic. Excellent presentation, ma'am. Super.
Thank you, sir.
Jinal madam, over to you.
I agree. Wonderful presentation, ma'am. Indeed inspiring for all of us. Next, I would like to call upon Dr. Kirti Mirche for her presentation. Dr. Kirti, the stage is all yours.
Am I audible? Hello.
Yes, ma'am, you're audible.
Thank you, Jinal ma'am. Thank you, Pallavi ma'am, for sharing PPT. Myself, Dr. Kirti Mirche. I am presenting the topic of role of diet and Panchakarma on PCOD. Next slide. Next slide. Objective. PCOS is also leading cause of infertility. Weight and lifestyle management are the first line therapy in international evidence-based guidelines for PCOS. Women with a PCOS also display the higher rate of weight gain. One woman in a 10 women in India suffering from PCOD or PCOS. Patient for this case series, I have taken the 3 patients. Age, pre-treatment history are shared in the PPT. Age for P1 patient 28, P2 23, P3 20. Profession IT for P1, P2 IT, and for P3 UPSC aspirant. Duration of disease 6 years for P1, 10 years for P2, P3 7 years. Weight 68 for P1, 70 for P2, and P3 65. APG 99 for P1, P2 93, P1 95. BMI 31 for P1, P2 28, and P3 30. Menstrual cycle irregular for 3 of them. Menstrual cycle frequency 4 cycle per year for P1, 6 cycle per year for P2, for P3 4 cycle per year. In symptoms, pelvic pain and hirsutism was common for 3 of them. In a blood investigation, I have done thyroid profile and fasting serum insulin, which was normal for 3 of them. In the main investigation for three patients is a UHG report. In UHG report for P1, PCO changes are seen. For P1, P2 and P3, bilateral PCOD changes are seen. Next slide. According to the UHG report, the diagnosis PCOD. Next slide. For in a treatment purpose, we have started with oral medicines, polyherbal formulation, which act as an antioxidant immunomodulator, promotes the lipolysis, decrease the fat deposition, and increase the BMR. In diet, 1000 kilocalorie diet, customized diet was given to patient for 2 months, which is low carb, high fiber, protein, high protein, antioxidant, vitamin C rich diet. In Panchakarma, Snehan neem plus til oil, Svedan Dashmul Kadha, Basti treatment with Kulit extract, Nagvel Patra extract, Gudmar extract, along with the Shirodhara of 10% Jatamasha decoction for the weight loss purpose. Next slide. Treatment with a timeline. Baseline, along with the 6 Panchakarma treatment for weight loss, polyherbal formulation, 1000 kilocalorie diet, aerobic exercise such as swimming, cycling, walking was added. In yoga, Surya Namaskar, Omkar, and pranayam is added. In a follow-up treatment, additional 5 Panchakarma treatment was added for compliance. Next. Result after treatment. Weight reduction for P1 patient, weight is 59, for P2 63, for P3 57, ABG 95, for P1, P2 89, P3 91, BMI 26 for P1, P2 25, P3 25. Menstrual cycle frequency 11 cycle per year for P1, P2 8 cycle per year, and 9 cycle for P3. Symptoms, no symptom of pelvic pain and hirsutism. EHG report after 1 year of treatment, single intrauterine pregnancy of 7 weeks for the P1 patient. For P2 and P3, no abnormalities seen. Patient assessment for 3 of them, improvement due to the weight reduction by regular exercise and diet compliance. And for the management purpose, investigation is advised yearly UHG. Next slide. These are the reports of patient for P1 before and after treatment. Second, next slide. For P2 patient. Next, for P3 patient. Next, discussion. In a present study, we have done the treatment on young female of 20 to 30 years with obesity, gynecological problem of irregular period. pelvic pain, hirsutism with an abnormal EHG report. Shows the PCOD, the weight reduction done by Ayurvedic treatment of Snehan, Svedan, Pasti, and Shirodhara with a polyherbal formulation and 1000 kilocalorie customized diet. After the weight reduction, it was observed that there was the improvement in the EHG report that showed no abnormality with a symptomatically improvement in the frequency of menstrual cycle and the reduction in a pelvic pain and hirsutism. The EHG report of the married patient showed the single intrauterine pregnancy of 7 weeks. Result. The conclusion. The baseline polyherbal formulation, diet modification, and set Ayurvedic medicinal Panchakarma contains Snehan, Svedan, Basti, Shirodhara can reduce the obesity. As per the observed result, it was concluded that PCOD can manage by the weight reduction, and after treatment, patient maintain weight through the lifestyle modification. Next, thank you. These are some references. Thank you.
Wonderful. Dr. Rajeev Gupta, sir, any questions for the presenter? Dr. Omkar, sir, questions for the presenter?
Yes, Dr. Kirti, fantastic results. Falashruti hi agar itni achhi hogi, so definitely the purpose of the patient coming to a doctor has been resolved, right? So I just wanted to ask whether any internal medications were given, because I couldn't see some specific medicines in this presentation.
Oral medicine, sir?
Yes.
Okay. Oral medicine is polyherbal formulation was given, such as name as Lipox, Mednox, Vincol Churna, Alluri liquid was given to the patient.
Fine, because the pathophysiology of PCOS is such that the kshetra is of Apanavayu and the Pitta dosh over there. Now you can see Pitta Kshaya in that case and Kapha Vruddhi in that case. So the treatment pathology will be reducing down the Vata Prakop and the Kapha, right? And so that the Pitta ovulation phase is enhanced, and definitely every month ovum is released, and then obviously you can get the good results. So I think the logic behind the whole therapy was very well executed by you, and that's how you have got good results in this case, right?
Yes,
Superb, fantastic presentation.
Thank you, sir.
Jinal ma'am.
Yes, we are nearing the end of our session. I would like to remind once again to both the chairpersons to score all presenters and send the scores to me individually. Next, I would like to call upon Dr. Preeti Sarvere, madam. Ma'am, the stage is all yours.
Yes,
ma'am, go ahead.
Good afternoon. Myself, Dr. Preeti Sarvere, Jetpura Gate, Chandrapur. My case's presentation topic is to study the efficacy of ischemia reversal the program with portion controlled diet on plaque regression. Introduction: the annual number of the death from the coronary artery disease in India is projected to rise from 2.26 million to 4.77 million. India currently has the highest burden of acute coronary syndrome. This put additional burden on the country economic and call for need to develop effective and economical treatment measure. The present study evaluates the efficacy of ischemia reversal program and portion control diet kit on plaque regression. Case details, case type observational study and Madhubak Chandrapur Clinic. Study period from August 2020 to 2021 and sample size is 3. Material main age group 43 to 82. BMI above 20.
Go away, yeah.
Abdomen girth is 80 to 125. CT angiography duration is 3 to 4 months. Biotomax 90 days, DT Duke score is 90 days, lipid profile 90 days, and diet monitoring by patient, diet photos by MIMPulse app. Patient history, case 1. One of my patient, case 1 is a known case of CAD, ISD, unstable angina, dyslipidemia. Past history is paralytic episode suffer on January 2019. CAG done 28/9/2020. Patient baseline complaint is chest pain, disturbed sleep, left arm pain after exertion. Case 2, patient known case of CAD and dyslipidemia DM. Past history MI and DM. Baseline complaint is chest pain and DOE. Case 3, 82 years, known case CAD, ISD, unstable angina, HTM. History MI. Baseline complaint facial edema, disturbed sleep, fullness of abdomen, chest pain, DOE, constipation. Patient vitals case 1, case 2, and case 3, BMI, abdomen girth, and VO2 max and Duke score. All 4 parameters are improved. Then we have done in patient ischemic reversal program, that is a centripetal orientation, thermal vasodilatation, per rectal administration. Main basic treatment is per rectal administration. We have to use Tabulus terrestris, which is a vasodilatic effect, and curcuma longa, which is an anti-inflammatory effect. Phyllanthus umbilica, reduce the oxidative stress. Concept and content portion control diet kit is low calorie diet, means 1000 kilocalorie diet, low carbohydrate, moderate protein, moderate fat, and high ORAC values, and maximum vitamin C, fortified vitamin E. And some contains madhuprash, cardiac tea, muthia mix, soya mix, dhokla, rajma flour, atta mix, lentil dal, herb masala, chutney mix, nut mix, all things with the help of dietitians. Medicine tapering, all patients are tappers, all medicines. Then plaque volume regression, case 1, case 2, case 3, all patients, all LAD, LCX and RCA, regression of plaque within the 3 to 4 months, and average BMI reduction also improved 25 to 23 in case 1, 28 to 24 in case 2, and 23 to 21 in case 3. Average vitals just like BMI, abdomen girth, VO2 max, Brooks score, cholesterol, triglyceride, HDL, LDL, all things are improved in 3 patients. My result is plaque reduction 540 mm to 290. Like 61% plaque regression in all of 3 averagely pair. CT angiography reports here. Then my conclusion is the mean of baseline total atheroma value before the treatment is 450.83 mm, and after the treatment total atheroma value is 209.1 mm. Total atheroma value is reduced by 331.73, means p value is below 0.0136. The baseline average BMI of the patient decreased from 25.68 to 23.08, means p value is below the 0.0422. The difference is considered to be statistically significant. Thus, we can conclude that IRP treatment and portion control diet box is effective in plaque reduction. Thank you.
Thank you, ma'am. Dr. Rajeev Gupta, sir, any questions for the current presenter?
I think I would like to congratulate. That's actually a very good study. And obesity is one of the big problem, and I work on it. I do weight management clinics in UK. I think it's much bigger problem in the Western countries compared to India, where malnutrition still exists. We don't have any malnutrition. The only problem of nutrition that we have is obesity. So from what you are saying, that actually is giving a statistically significant result, although one is 0.04, which is kind of just below the significant level, but 0.01 is fantastic. So if this is coming that way, I think it is very promising. I was thinking it might be a good idea if you could do subset of the dietary intervention only, or the whatever herbal products you use. If you do subset and find the statistical value of each subset, that would be a far superior result if possible. Because I'm thinking is it may change the way people live. So it's a lifestyle intervention which can be of huge benefit. So I think that's probably more important. I wanted to ask you the question, what is your plan, long-term plan? Are you going to do it on a long-term? Can you collaborate with other centers? Because we have got so many people in here. If many people can collaborate and they can get the same result, it will become more replicable, more reliable. And I think we can write together our experience in like Western world and experience in India together on how we can do it. So
Yes.
thank you.
Certainly. Thank you, sir. Dr. Omkar, sir, questions for the current presenter?
Well, I will like to ask the same question to Rahul, sir. That's the only reason I have spotlighted, sir. So, Rahul, sir, if you can just throw some light on the question asked by Rajeev Gupta, sir.
Yes, Dr. Gupta, sir, thanks for your kind word. And really, Dr. Preeti Sarvare, she's a gem of Madhavbag, and she did a wonderful job. And she is practicing in Chandrapur. It's a very small town in Maharashtra, and at just very small place, she is conducting kind of the CT coronary series of CT coronary angiography and presented the data very well. She treated all the coronary artery disease patient very well, and the compilation of all the evidence is what she is having of coronary artery disease. So excellent, Dr. Preeti ma'am. Sir, recently last year, the team of Madhavbag, we have collected around 300 plus coronary artery disease patients, a series of CT angiography data. And we are fortunate enough that the same data is also selected for the Asian Journal of Preventive Cardiology for oral presentation. And also we have sent the same data for the few peer-reviewed journals also. We are waiting for the acceptance. And the good thing about that is normally in Ayurveda, we treat coronary artery disease patient and patient gets symptomatic relief. But here we objectively and precisely trying to understand what is the impact of this kind of intervention, the Ayurveda based intervention on the patient with the coronary artery disease with the CT coronary angiography as a volumetric analysis. The question that you have asked, whether the results are of only diet or whether the results is a comprehensive study. So we are conducting the same randomized control trial in the Bangalore, and it's almost more than 6 months we have started the randomized control trial in the Bangalore, where we are giving the patient this diet or ahara as a pathya for the patient who are having the CAD. And in a control arm, the patient will be on a conventional oral medication treatment only. So maybe a year or two, we will be coming up with the result. Maybe this only by changing the pathya, or maybe by changing the ahara of a patient. Because what we understood from the disease pathology is the hridrog is a samprapti because of a rasadhatu dushti, and ahara is a major cause of a rasadhatu dushti. So if we can just make a change in the ahara, so definitely there will be a tremendous change in the patient's clinical outcome. And the same results that Dr. Preeti Sarvare has shown, I really mesmerized when she's shown that CT angiography pre and post results, where the patient's plaque were completely disappeared in the follow-up. So keep it up, Dr. Preeti, and thanks a lot, Dr. Rajeev sir, for all the kind words. Definitely, we will looking forward for the collaborative research on that aspect, where we can study the same, because as per the geographical area, it is that ahar that we are advising to the patient is Indian food. So we need to come to principally we have to come to some same platform where we can we can give same ahara to the even the European patients also. So definitely, if we come together, definitely we can make the global impact of Ayurveda. Thank you, sir.
Perfect. We'll do that. Thanks.
Thank you, sir.
It's Dr. Preeti, excellent presentation. Now, I just want to emphasize on some of the parametric improvement which you have highlighted over here. Not only the VO2 max has improved, the DTS score of the patient has improved, but the plaque volume from 540 mm cube to 209 mm cube, that is 61% regression in the plaque volume. This is just super. So wishing you best luck for n number of future patients which you handle, and this was an awesome presentation. Super.
Thank you, sir.
Yes, Dr. Jinal.
Yes, before I call upon the last presenter for the evening, I would again like to remind the chairpersons to share the scores for the presenters individually with me over personal message. Now, lastly, I will call upon Dr. Asha Shabrani ma'am to share her presentation. Dr. Asha, the stage is all yours.
I'm Dr. Asha Shabrani from Akola, Kolkhed Chowk. Today's my case study is about the effects of lifestyle modification in tackling depression in obese patients. Next slide, please. My objective about this study is that anxiety disorders rank with largest number of health loss in the overall studies in the 2015. So the early identification and management of anxiety disorders among the adolescents prevent future complication and improve the quality of life. Next slide. A 22-year case patient present to my clinic on 21st of July 2022. His complaints were of lethargy, social phobia, running of nose, and plucking of her eyebrow hairs. She was having psychiatric treatment since last 3 years and diagnosed as trichotillomania. Approached to me for Ayurvedic treatment. Next slide, please. Patient was 22 years old and she was having social phobia since 2016. In 2020, her family members found that she's plucking her eyebrows hair. In 2021, she has stopped her education, and at 2022, her antidepressants were started. In the mean period, patients were visited to multiple doctors like dermat, first to her family physician, next to dermat, and finally to the psychiatrist. Next slide, please. So after getting all the details and the clinical diagnosis about this patient, I conclude the conclusion that this must be the case of obesity class 2, and because of that, maybe patient lands into the depression. Next slide, please. According to my diagnosis, I have started treatment on this patient along with polyherbal medication and low carb diet. So here are the results that the patient's lost her weight from 106 to 93, and her BMI also get reduced from 35 to 30. BP, which was shooting up, also get reduced, and her heart rate was stagnant, but her abdominal girth was reduced from 122 to 103. Next slide, please. In this case, I have used the oral medication of ashwagandha tablets, Gomutra Haritaki, Anutil Nasya, and diet was 1000 calories, restricted, low fat, high fiber diet. Along with that, I have given Panchakarma therapy, that is Snehan, Abhyanga with rose oil and sesame oil for 20 minutes, and Swedana, that is thermal vasodilation with Dashmul extract, and Shirudhara with the Jata Manchikwa. Next slide, please. Here, ashwagandha is a rasayan, and it's a good source of bioactive constituents like annulites and vitaparin, which act as antioxidant. Hence, it is useful for stress, and it revitalizes brain and nerves. Gomutra Haritaki is a classical combination of Pancharasatmak Haritaki and Gomutra. This both acts as fat burner. Shodhan Nasya removes the kapha and sama from intellect and lightens intellectual and neurological function. Jatamanshi Twat is Madhura Kashaya Shita and Kapha Pitta Nashini. Jatamanshi, by virtue of its prabhava, is effective on psychological disorders. Also, it is Maidya drug. Through the Shirodhara, it specifies hyperactivated sympathetic nervous system, settle down increased heart rate, and reduces the peripheral resistance, facilitates sound sleep, and gives ability to withstand stress. Next slide, please. Thank you. In this case, I have found that patient now now her social phobia gets reduced. So I have presented this case.
Thank you, madam. Dr. Rajeev Gupta, sir, any questions for the presenter?
No, I think it's fine. It is encouraging what you're doing. So try and do a bigger scale, and that will be really useful. Thank you.
Dr. Omkar, sir, any questions for the presenter?
Yes, Dr. Asha, what is the best part of this result from the patient's point of view? Which parameter do you feel was reduced and the patient was quite happy?
So stress got reduced. On the objective parameters, I doesn't got any significant improvement. Even I am studying about that. But from the patient's perspective, she is having great improvement. In the month of December, she have planned tour along with her friends only, without her
Fantastic.
family.
You have one very good parametric improvement. Abdominal girth of the patient from 122 centimeters, it's reduced down to 103 centimeters. You know, so आईने में वो patient वो shrink होके जब नजर आएगी, तो that's a big achievement, na? Right? So whenever such patients come to us, definitely remind them about their college days. Whether the clothes used in the college days, they can use it now, right? So this is what we can give them. Those memories are quite awesome, right? And I think this is a great achievement. Your presentation was bang on, super. Thank you.
Thank you.
With this, we have come to end of session 1 for the day 3 of second National Ayurveda Cardiology Symposium. Indeed, I would like to congratulate all the presenters, beautifully presented, and we will tally the marks and announce the best presenter in a while. Till then, would Dr. Rahul sir like to share anything with us, sir?
Really wonderful session, and it was absolute feast of knowledge and the clinical expertise what we are blessed with. Dr. Rajeev sir and Dr. Omkar, you both have actually shared a huge amount of knowledge with all the presenters. All the 13 presenters were absolutely superb, and the way they have presented their clinical cardiology experience on this global platform is really commendable. What I am trying to emphasize here is all the doctors who I have presented here, they are the clinical practitioners, and while doing their clinical practice, whatever they have observed, whatever evidences they could have gathered. We listened to doctor from the Buldana, and he was telling that patient is not affordable, so he was not even it was not possible for him to go and do the investigation. So he was very happy with what results what he has got. So it's very difficult to conduct the evidence-based best practice in a rural or even in the semi-rural or the semi-urban part of India, because patients' affordability always comes in picture, and when the doctors has to be behind the patient every time. So regardless of all the difficulties that the doctors have must have been faced, they came here with all the evidence, with all the courage, with all the skills of presentation. Few points where I would like to make some comment, like if we can make the presentation as per the standard, like a care guideline, what have been given for the case presentation, or the consort guideline which have been given for the cohort presentation, that would make your presentation more impactful. I think we should continuously, when we will be continuously presenting on such kind of a platform. Definitely we will adopt those guidelines very easily, and definitely the next year or the next time we can see the much better presentations from all the doctors of this National Ayurveda Cardiology Symposium. So I'm from bottom of my heart, I'm thankful to Dr. Rajeev Gupta sir and Dr. Omkar sir again, and thanks to Dr. Jinal Thakkar as well, because since the afternoon she is taking very working hard, and she is continuously behind all the presenters, and the coordinator Ms. Pallavi Mohe, she is working in the background and continuously sharing the presentations of all the doctors. So Great. Thanks to all, and over to Dr. Jinal. Because I think everyone is excited and they can't hold their patients back now. It's time for a result. So please go ahead, Dr. Jinal.
Yes, thank you, sir. Thank you very much. I myself am really thrilled to be congratulating the winner. The winner is it was a very neck to neck competition, and the winner takes it away by just 0.5 marks of lead. The winner is Dr. Preeti Selvare, madam. Ma'am, congratulations. You have been the best presenter of the session.
Congratulations, Dr. Preeti.
Thank you, sir.
Well done, well done. Good, really good work. And
Thank you,
all
sir.
of you were good. You all were good. So do not feel you did not get the highest marks or award, because this is just a step. There are multiple steps. We are all in life going through one by one by one by one, many steps. Sometimes you have a leap and you can go 3 steps in one go, but then you can't go 3 steps all the time. So
Thank you,
it's
sir.
good.
Congratulations to all the
Congratulations,
presenters.
Dr. Preeti ma'am.
Thank you, sir. Thank you so much.
With this, I think our very enthralling session 1 of day 3 comes to an end. I would like to thank both the chairpersons again for the great insight they've provided us in this evening. Thank you all the presenters for coming forward and sharing the cases. It was really wonderful to see so much good work going around. With this, I would mark the end of the session 1 of day 3. Thank you, everybody. Thank you very much.
Thank you so much.
Thank you so much. Have a great time. Bye for now.
Thank you so
Bye
much,
for you,
Rajeev,
sir.
sir.
Thank you, sir.